reading of Gray's Anatomy, first edition, published in 1858. Okay, this is the book binding of the page of the Terrano. Very strong twined linen was used to bind the book. A very beautiful pattern, embossed. Sorry. There we go. A beautiful pattern. Embossed book. We'll use this. See? And this is the shell of a fossil ammonite. Per ampliora ad altiora. Oliver Wendell Holmes. So this is a copy. This copy of the book used to originally belong to Oliver Wendell Holmes. It's a protected copy, preserved copy, conserved in the Boston Medical Library in the Francis A. Countway Library of Medicine in Boston. Anatomy, descriptive and surgical. Anatomy, descriptive and surgical by Henry Gray, Fellow of Royal Society, lecturer on anatomy at St. George's Hospital. The drawings were by H.V. Carter, Doctor of Medicine, late demonstrator of anatomy at St. George's Hospital, and the dissections were done jointly by the author and Dr. Carter. Published in London by John W. Parker and Son, West Strand, in the year 1858. Printed in London by Wertheimer and Co., Finsbury Circus. Dedicated to Sir Benjamin Collins Brodie, barrister, Fellow of Royal Society, and DCL, Surgeon to the Queen, corresponding member of the Institute of France. This work is dedicated in admiration of his great talents and in remembrance of many acts of kindness shown to the author from an early period of his professional career. Preface. This work is intended to furnish the student and practitioner with an accurate view of the anatomy of the human body and more especially the application of this science to practical surgery. One of the chief objects of the author has been to induce the student to apply his anatomical knowledge to the more practical points in surgery by introducing in small type under each subdivision of the work such observations as show the necessity of an accurate knowledge of the part under examination. Osteology. Much time and care have been devoted to this part of the work, the basis of anatomical knowledge. It contains a concise description of the anatomy of the bones, illustrated by numerous accurately lettered engravings showing the various markings and processes on each bone. The attachments of each muscle are shown in red dotted lines after the plan recently adopted by Mr. Holden, copied from recent dissections. The articulations of each bone are shown on a new plan, and a method has been adopted by which the hitherto complicated account of the development of the bones is made more simple. The articulations. In this section, the various structures forming the joints are described, a classification of the joints is given, and the anatomy of each carefully described, abundantly illustrated by engravings, all of which are taken from or corrected by recent dissections. The muscles and fasciae. In this section, the muscles are described in groups as in ordinary anatomical works. A series of illustrations showing the lines of incision necessary in the dissection of the muscles in each region are introduced, and the muscles are shown in 52 engravings. The surgical anatomy of the muscles in connection with fractures of the tendons or muscles divided in operations is also described and illustrated. The arteries, the course, relations, and surgical anatomy of each artery are described in this section, together with the anatomy of the regions containing the arteries, more especially involved in surgical operations. This part of the work is illustrated by 27 engravings. The veins are described as in ordinary anatomical works and illustrated by a series of engravings showing those in each region. The veins of the spine are described and illustrated from the well-known work of Breschet. The lymphatics are described and figured in a series of illustrations copied from the elaborate work of Mascagni. The nervous system and organs of sense. A concise and accurate description of this important part of anatomy has been given, illustrated by 72 engravings showing the spinal cord and its membranes, the anatomy of the brain in a series of sectional views, the origin, course, and distribution of the cranial, spinal, and sympathetic nerves, and the anatomy of the organs of sense. The viscera. A detailed description of the essential part of anatomy has been given, illustrated by 50 large, accurately lettered engravings. Regional anatomy. The anatomy of the perineum, of the ischiorectal region, and of femoral and inguinal herniae is described at the end of the work. The region of the neck, the axilla, the bend of the elbow, Scarpa's triangle, and the popliteal space in the section on the arteries. The laryngotracheal region with the anatomy of the trachea and larynx. The regions are illustrated by many engravings. Microscopical anatomy. A brief account of the microscopical anatomy of some of the tissues and of the various organs has also been introduced. The author gratefully acknowledges the great services he has derived in the execution of this work from the assistance of his friend Dr. H.V. Carter, late demonstrator of anatomy at St. George's Hospital. All the drawings from which the engravings were made were executed by him. In the majority of cases, they have been copied from or corrected by recent dissections made jointly by the author and Dr. Carter. The author has also to thank his friend, Mr. T. Holmes, for the able assistance afforded him in correcting the proof sheets in their passage through the press. The engravings have been executed Mrs. Butterworth and Heath, and the author cannot omit thanking these gentlemen for the great care and fidelity displayed in their execution. Wilton Street, Belgrave Square, August 1858. Contents, we'll skip the contents. Illustrations also will skip. Descriptive and surgical anatomy. Descriptive anatomy comprises a detailed account of the numerous organs of which the body is formed, especially with reference to their outward form, their internal structure, the mutual relations they bear to each other, and the successive conditions they present during their development. Surgical anatomy is, to the student of medicine and surgery, the most essential branch of anatomical science, having reference more especially to an accurate knowledge of the more important regions and consisting in the application of anatomy generally to the practice of surgery. The study of anatomy is commonly divided into several distinct branches according to the natural resemblance of the organs, and these branches have corresponding denominations. Osteology. In the construction of the human body, it would appear essential in the first place to provide some dense and solid texture capable of giving support and attachment to the softer parts of the frame, and at the same time to protect enclosed cavities, the more important vital organs. And such a structure we find provided in the various bones which form what is called the skeleton. Bone is one of the hardest structures of the animal body. It possesses also a certain degree of toughness and elasticity. Its color in a fresh state is of a pinkish white externally and deep red within. Chemical analysis resolves bone into an organic or animal and an inorganic or earthy material intimately combined together. The animal matter giving to the bone its elasticity and toughness, the earthy part its hardness and solidity. The animal constituent may be separated from the earthy by steeping bone in a dilute solution of nitric or muriatic acid. By this process, the earthy constituents are gradually dissolved out, leaving a tough, semi-transparent substance which retains in every respect the original form of the bone. This is often called cartilage, but differs from it in being softer, more flexible, and when boiled under a high pressure, it is almost entirely resolved into gelatin. The earthy constituent may be obtained by subjecting a bone to strong heat in an open fire with free access of air. By these means, the animal matter is entirely consumed, the earthy part remaining as a white brittle substance, still preserving the original shape of the bone. The organic or animal constituent of bone forms about one third or 33.3%. The inorganic or earthy matter, two thirds or 66.7%, as is seen in the subjoined analysis by Berzelius. Animal matter, gelatin, and blood vessels make up 33.3%. Inorganic or earthy matter, of which phosphate of lime constitutes 51.04%, carbonate of lime constitutes 11.3%, fluoride of calcium constitutes 2%, phosphate of magnesia constitutes 1.16%, soda and chloride of sodium constitute 1.2%. The proportion between these two constituents varies at different periods of life, as is seen in the following table from Schreier. The animal matter in child is 47.2%, in an adult 20.18%, and in extreme old age it becomes 12.2%. Whereas the earthy matter in a child is 48.48%, and in adult it becomes 74.84%, and in old age it becomes 84.1%. There are facts of some practical interest bearing upon the difference here seen in the amount of the two constituents of bone at different periods of life. Thus, in the child, where the animal matter forms nearly one half of the weight of the bone, it is not uncommon to find, after an injury happening to the bones, that they become bent or only partially broken from the large amount of flexible animal matter which they contain. Again, also in aged people, where the bones contain a large proportion of earthy matter, the animal matter at the same time being deficient in quantity and quality, the bones are more brittle, their elasticity is destroyed, and hence fracture takes place more readily. Some of the diseases also to which bones are liable mainly depend on the disproportion between the two constituents of bone. Thus, in the disease called rickets, so common in the children of scrofulous parents, the bones become bent and curved either from the superincumbent weight of the body or under the action of certain muscles. This depends upon some deficiency of the nutritive system by which bone becomes minus its normal proportion of earthy matter, whilst the animal matter is of unhealthy quality. In the vertebra of a rickety subject, Dr. Bostock found in 100 pars 79.75 animal and 20.25 earthy matter. Mohan's comment. Actually, here Dr. Gray calls the deficiency as some deficiency of the nutritive system. In later times, it was discovered to be vitamin D actually, or cholecalciferol. End of comment. The relative proportions of the two constituents of bone are found to differ in different bones of the skeleton. Thus, the petrous portion of the temporal bone contains a large proportion of earthy matter. The bones of the limbs contain more earthy matter than those of the trunk, and those of the upper extremity a larger proportion than those of the lower. On examining a section of any bone, it is seen to be composed of two kinds of tissue, one of which is dense and compact in texture like ivory, the other open, reticular, spongy, enclosing cancelli or spaces, and hence called spongy or cancellated tissue. The compact tissue is always placed on the exterior of a bone. The cancellous tissue is always internal. The relative quantity of these two kinds of tissue varies in different bones and in different parts of the same bone as strength or lightness is requisite. Form of bones. The various mechanical purposes for which bones are employed in the animal economy require them to be of very different forms. All the scientific principles of architecture and dynamics are more or less exemplified in the construction of this part of the human body. The power of the arch in resisting superincumbent pressure is well exhibited in various parts of the skeleton, such as the human foot, and more especially in the vaulted roof of the cranium. Bones are divisible into four classes: long, short, flat, and irregular. The long bones are found chiefly in the limbs, where they form a system of levers which have to sustain the weight of the trunk and to confer extensive powers of locomotion. A long bone consists of a lengthened cylinder or shaft and two extremities. The shaft is a hollow cylinder, the walls consisting of dense compact tissue of great thickness in the middle and becoming thinner towards the extremities. The spongy tissue is scanty and the bone is hollowed out in its interior to form the medullary canal. The extremities are generally somewhat expanded for greater convenience of mutual connection and for the purposes of articulation. Here the bone is made up of spongy tissue with only a thin coating of compact substance. The long bones are the clavicle, humerus, radius, ulna, femur, tibia, fibula, metacarpal and metatarsal bones and the phalanges. Short bones. Where a part is intended for strength and compactness, and the motion at the same time slight and limited. It is divided into a number of small pieces united together by ligaments, and the separate bones are short and compressed, such as the bones of the carpus and tarsus. These bones, in their structure, are spongy throughout, excepting at their surface, where there is a thin crust of compact substance. Flat bones, where the principal requirement is either extensive protection or the provision of broad surfaces for muscular attachment, we find the osseous structure remarkable for its slight thickness, becoming expanded into broad flat plates as is seen in the bones of the skull and shoulder blade. These bones are composed of two thin layers of compact tissue enclosing a layer of cancellous tissue of variable thickness. In the cranial bones, these layers of compact tissue are familiarly known as the tables of the skull. The outer one is thick and tough, the inner one thinner, denser, and more brittle, and hence termed the vitreous table. The intervening cancellous tissue is called the diplo. The flat bones are the occipital, parietal, frontal, nasal, lacrimal, vomer, scapulae, and ossa innominata. The irregular or mixed bones are such as, from their peculiar form, cannot be grouped under either of the preceding heads. Their structure is similar to that of other bones, consisting of an external layer of compact and of a spongy cancellous substance within. The irregular bones are the vertebrae, sacrum, coccyx, temporal, sphenoid, ethmoid, superior maxillary, inferior maxillary, palate, inferior turbinated, and hyoid. Vessels of the bone. The blood vessels of bone are very numerous. Those of the compact tissue consist of a close and dense network of vessels which ramify in a fibrous membrane termed the periosteum, which covers the entire surface of the bone in nearly every part. From this membrane, vessels pass through all parts of the compact tissue, running through the canals which traverse its substance. The cancellous tissue is supplied in a similar way, but by a less numerous set of larger vessels, which, perforating the outer compact tissue, are distributed to the cavities of the spongy portion of the bone. In the long bones, numerous apertures may be seen at the ends near the articular surfaces, some of which give passage to the arteries referred to, but the greater number, and these are the largest of them, are for the veins of the cancellous tissue which run separately from the arteries. The medullary canal is supplied by one large artery, or sometimes more, which enters the bone at the nutritious foramen, situated in most cases near the center of the shaft, and perforates obliquely the compact substance. This vessel, usually accompanied by one or two veins, sends branches upwards and downwards to supply the medullary membrane, which lines the central cavity and the adjoining canals. The ramifications of this vessel anastomose with the arteries of both of cancellous and compact tissues. The veins of bone are large, very numerous, and run in tortuous canals in the cancellous texture, the sides of which are constructed of a thin lamella of bone, perforated here and there for the passage of branches from the adjacent cancelli. The veins, thus enclosed and supported by the hard structure, have exceedingly thin coats, and when the bony structure is divided, they remain patulous and do not contract in the canals in which they are contained. Hence, the constant occurrence of purulent absorption after amputation in those cases where the stump becomes inflamed and the cancellous tissue is infiltrated and bathed in pus. Lymphatic vessels have been traced into the substance of bone. Nerves also accompany the nutritious arteries into their interior. Development of bone. From the peculiar uses to which bone is applied, informing a hard skeleton or framework for the softer materials of the body, and in enclosing and protecting some of the more important vital organs. We find its development take place at a very early period. Hence, the parts that appear soonest in the embryo are the vertebral column and the skull, the great central column, to which the other parts of the skeleton are appended. At an early period of embryonic life, the parts are destined to become bone, consist of a congeries of cells which constitutes the simplest form of cartilage. This temporary cartilage, as it is formed, is an exact miniature of the bone which in due course is to take its place. And as the process of ossification is slow and not completed until adult life, it increases in bulk by an interstitial development of new cells. The next step in this process is the ossification of the intercellular substance and of the cells composing the cartilage. Ossification commences in the interior of the cartilage at certain points called points or centers of ossification, from which it extends into the surrounding substance. The period of ossification varies much in different bones. It commences first in the clavicle, in which the primitive point appears during the 5th week. Next, in the lower jaw. The ribs also and the long bones of the limbs appear soon after. The number of ossific centers varies in different bones. In most of the short bones, it commences by a single point in the center and proceeds towards the circumference. In the long bones, there is a central point of ossification for the shaft or diaphysis and one for each extremity, the epiphysis. That for the shaft is the first to appear, those for the extremities appear later. For a long period after birth, a thin layer of unossified cartilage remains between the diaphysis and epiphysis until their growth is finally completed. Processes such as the trochanthus that have separate centers of ossification are called epiphyses previous to their union. Growth of bone. Increase in the length of a bone is provided for by the development of new bone from either end of the shaft or diaphysis, and in the thickness by the deposition of new matter upon the surface. But when growth is at an end, the epiphysis becomes solidly united to the ends of the diaphysis and the bone is completely formed. A knowledge of the exact periods when the epiphysis become joined to the shaft aids the surgeon in the diagnosis of many of the injuries to which the joints are liable. For it not unfrequently happens that on the application of severe force to a joint, the epiphysis becomes separated from the shaft, and such injuries may be mistaken for fracture. The order in which the epiphyses become united to the shaft follows a peculiar law which appears to be regulated by the direction of the nutritious artery of the bone. Thus, the arteries of the bones of the arm and forearm converge towards the elbow, and the epiphyses of the bones forming this joint become united to the shaft before those at the opposite extremity. In the lower extremities, on the contrary, the nutritious arteries pass in a direction from the knee, that is, upwards in the femur, downwards in the tibia and fibula, and in them it is observed that the upper epiphysis of the femur and the lower epiphysis of the tibia and fibula become first united to the shaft. A diseased condition of any joint makes considerable variation in the period of development of the several bones which enter into its formation. Thus, in chronic inflammation occurring in a joint at an early period of life, the epiphyseal cartilages take on premature ossification, this process proceeding so rapidly that it speedily becomes converted into bone, which becomes united to the shaft, and the bone ever after is considerably diminished in length. Hence, partial atrophy of the limb is the result. The entire skeleton in an adult consists of 206 distinct bones. These are the The cranium, which constitutes of 8 bones, orsicula auditus, constituted of 6 bones, face, constituted by 14 bones, vertebral column, sacrum and coccyx included, constituted by 26 bones, os hyoides, sternum and ribs, constituted by 26 bones, upper extremities made up of 64 bones, and lower extremities made up of 62 bones. So in total 206 bones. In this enumeration, the sesamoid and wormian bones are excluded, as also are the teeth, which differ from bone both in structure, development, and mode of growth. The skeleton consists of a central column or spine of 3 great cavities, the skull, thorax, and pelvis, and of the superior and inferior extremities. The spine. The spine is a flexuous column formed of a series of bones called vertebrae. The vertebrae are divided into true and false. The two vertebrae are 24 in number and have received the names cervical, dorsal, and lumbar according to the position which they occupy. 7 being found in the cervical region, 12 in the dorsal, and 5 in the lumbar. The false vertebrae, 9 in number, are firmly united so as to form 2 bones, 5 entering into the formation of the upper bone or sacrum, and 4 into the terminal bone of the spine or coccyx. True vertebrae, in all 24, are made of 7 cervical, 12 dorsal, and 5 lumbar. False vertebrae are 9, made up of 5 sacrum and 4 coccyx vertebrae. Mohan's comment: the 12 dorsal vertebrae are in later times called thoracic, but somehow why Henry Gray is calling them as dorsal is probably because the terminology probably comes from the animal anatomy, and also probably at this time the term thorax might have been used to designate the whole of the trunk, basically thorax as well as abdomen. So probable reasons. End of comment. General characters of the vertebrae. Each vertebra consists of 2 parts, an anterior solid segment or body forming the chief pillar of support, a posterior segment, the arch, forming part of a hollow cylinder for protection. The arch is formed of 2 pedicels and 2 laminae supporting 7 processes with 4 articular, 2 transverse, and 1 spinous forces. The body is the largest and most solid part of a vertebra, serving to support the weight of the cranium and trunk. Above and below, it is slightly concave, presenting a rim around its circumference, and its surfaces are rough for the attachment of the intervertebral fibrocartilages. In front, it is convex from side to side, concave from above downwards. Behind, flat from above downwards, and slightly concave from side to side. Its anterior surface is perforated by a few small apertures for the passage of nutrient vessels, whilst on the posterior surface is a single irregular shaped or occasionally several large apertures for the exit of veins from the body of the vertebra, the venae basae vertebrae. The pedicles project backwards, one on each side, from the upper part of the body of the vertebrae at the line of junction of its posterior and lateral surfaces. They form the lateral parts of the arch, which is completed posteriorly by the 2 laminae. The concavities above and below the pedicles are the intervertebral notches. They are 4 in number, 2 on each side, the inferior ones being always the deeper. The laminae consist of two broad plates of bone which complete the vertebral arch behind, enclosing a foramen which serves for the protection of the spinal cord. They are connected to the body through the intervention of pedicles. Their upper and lower borders are rough for the attachment of the ligamenta subflava. The spinous process projects backwards from the junction of the two laminae and serves for the attachment of muscles. The transverse processes, two in number, project one at each side from the point where the articular processes join the pedicle. They also serve for the attachment of muscles. The articular processes are four in number, two superior, the smooth surfaces of which are directed more or less backwards, and two inferior, the articular surfaces of which look more or less forwards. Characters of the cervical vertebrae shown in figure 1. The body is smaller than in any other region of the spine, thicker before than behind, and broader from side to side than from before backwards. Its upper surface is concave transversely and presents a projecting lip on each side. Its lower surface being convex from side to side, concave from before backwards, and presenting laterally a shallow concavity which receives the corresponding projecting lip of the adjacent vertebra. The pedicles are directed obliquely outwards, and the superior intervertebral notches are slightly deeper but narrower than the inferior. The laminae are narrow, long, thinner above than below, and imbricated, that is, overlapping each other, enclosing the foramen, which is very large and of a triangular form. The spinous processes are short, bifid at the extremity, the two divisions being often of unequal size. They increase in length from the fourth to the seventh. The transverse processes are short, directed downwards, outwards, and forwards, bifid at their extremity, and marked by a groove along their upper surface, which runs downwards and outwards from the superior intervertebral notch and serves for the transmission of one of the cervical nerves. The transverse processes are pierced at their base by a foramen for the transmission of the vertebral artery, vein, and plexus of nerves. Each of these processes is formed by two roots. The anterior or smaller, which is attached to the side of the body, corresponds to the ribs in the dorsal region. The posterior is larger, springs from the pedicle, and corresponds to the true transverse processes. It is by the junction of these two processes that the vertebral foramen is formed. The extremities of each of these roots form the anterior and posterior tubercles of the transverse processes. The articular processes are oblique. The superior are of an oval form, flattened and directed upwards and backwards. The inferior downwards and forwards. The peculiar vertebrae in the cervical region are the first are atlas, the second are axis, and the seventh are vertebra prominence. The atlas, shown in figure 2, so named from supporting the globe of the head. The chief peculiarities of this bone are that it has neither body, spinous processes, nor pedicles. It consists of an anterior arch, a posterior arch, and two lateral masses. The anterior or lesser arch, which forms about 1/5 of the bone, represents the front part of the body of a vertebra. Its anterior surface is convex and presents about its center a tubercle for the attachment of the longest colli muscle. Posteriorly, it is concave and marked by a smooth oval surface for articulation with the odontoid process of the axis. The posterior or greater arch, which forms about two-fifths of the circumference of the bone, terminates behind in a tubercle, which is the rudiment of a spinous process and gives origin to the rectus capitis posticus minor. The posterior part of the arch presents above a rounded edge, whilst in front, immediately behind the superior articular processes, are two grooves, sometimes converted into foramina by delicate bony spiculae. These grooves represent the superior intervertebral notches and are peculiar from being situated behind the articular processes instead of before them as in the other vertebrae. They serve for the transmission of the vertebral artery, which, ascending through the foramen in the transverse process, winds around the lateral mass in a direction backwards and inwards. They also transmit the suboccipital nerves. On the undersurface of the posterior arch, in the same situation, are two other grooves placed behind the lateral masses and representing the inferior intervertebral notches of other vertebrae. They are much less marked than the superior. The lateral masses, which are the most bulky and solid parts of the atlas, present two articulating processes above and two below. The two superior are of large size, oval, concave, and approach towards one another in front, but diverge behind. They are directed upwards, inwards, and a little backwards, forming a kind of cup for the condyles of the occipital bone and are admirably adapted to the nodding movements of the head, whilst the inferior, which are circular in form and flattened, are directed downwards, inwards, and a little backwards, articulating with the axis and permitting the rotatory movements. Just below the inner margin of each superior articular surface is a small tubercle for the attachment of a ligament which, stretching across the ring of the atlas, divides it into two unequal parts. The anterior or smaller segment receiving the odontoid process of the axis, the posterior allowing the transmission of the spinal cord and its membranes. This ligament and the odontoid process are marked in the figure in dotted outline. The transverse processes are of large size, long, not bifid, perforated at their base by a canal for the vertebral artery, which is directed from below upwards and backwards. The axis, shown in figure 3, so named from forming the pivot upon which the head rotates. The most distinctive character of this bone is the existence of a strong prominent process, tooth-like in form, hence the name odontoid, which arises perpendicularly from the upper part of the body. The body is of a triangular form, its anterior surface deeper than the posterior, presents a median longitudinal ridge separating two lateral depressed surfaces for the attachment of the longi colli muscles. The odontoid process presents two oval articulating surfaces, one in front for articulation with the atlas, another behind for the transverse ligament. The apex is pointed, and on either side of it is seen a rough impression for the attachment of the odontoid or cheek ligaments, whilst the base, where attached to the body, is constructed so as to prevent displacement from the transverse ligament, which binds it in this situation to the anterior arch of the atlas. On each side of this process are seen the superior articular surfaces. They are round, convex, directed upwards and outwards, and are peculiar in being supported on the body, pedicles, and transverse processes. The inferior articular surfaces, which are posterior and external to these, have the same direction as those of the other cervical vertebrae. The superior intervertebral notches are very shallow and lie behind the articular processes. The inferior in front of them, as in the other cervical vertebrae, the transverse processes are very small, not bifid, and perforated by the vertebral foramen, which is directed obliquely upwards and outwards. The laminae are thick and strong, and the spinous process is of large size, very strong, deeply channeled on its undersurface, and presenting a bifid tubercular extremity for the attachment of muscles. Seventh, cervical. The most distinctive character of this vertebra is the existence of a very large, long, and prominent spinous process, hence the name vertebra prominens. This process is thick, nearly horizontal in direction, not bifurcated, and has attached to it the ligamentum nuchae. The foramina in the transverse processes are small, often wanting, and when present, do not give passage to the vertebral artery. Their upper surface presents only a slight groove and generally only a trace of bifurcation at their extremity. Characters of the dorsal vertebrae. The dorsal vertebrae, shown in figure 4, are intermediate in size between the cervical and lumbar. The body is somewhat triangular in form, broader in the anterior posterior than in the lateral direction, more particularly in the middle of the dorsal region, thicker behind than in front, flat above and below, deeply concave behind, and marked on each lateral surface near the root of the pedicle by two demifacets, one above the other below. These are covered with cartilage in the recent state, and when articulated with the adjoining vertebrae, form oval surfaces for the reception of the heads of the corresponding ribs. The pedicles are strong and the inferior intervertebral notches of large size. The laminae are broad and thick, and the spinal foramen small and of a round or slightly oval form. The articular surfaces are flat, the superior being directed backwards and a little outwards and upwards, the inferior forwards and a little inwards and downwards. The transverse processes are thick, strong, and of great length, directed obliquely backwards and outwards, presenting a clubbed extremity, lipped on its anterior part by a small concave surface for articulation with the tubercle of a rib. The spinous processes are long, directed obliquely downwards, and terminated by a tubercle. The peculiar dorsal vertebrae are the first, ninth, 10th, 11th, and 12th, as shown in figure 5. The first dorsal vertebra may be distinguished by the existence on each side of the body of a single entire articular facet for the head of the first rib and a half facet for the upper half of the second. The upper surface of the body is like that of a cervical vertebra, being broad transversely, concave, and lipped on each side. The superior articular surfaces are oblique and the spinous process thick, long, and almost horizontal. The ninth dorsal has no demifacet below. The 10th dorsal has an entire articular facet at each side above, no demifacet below. In the 11th dorsal, the body approaches in its form to the lumbar and has a single entire articular surface on each side. The transverse processes are very short and have no articular surfaces at their extremities. The 12th dorsal has the same characters as the 11th, but may be distinguished from it by the transverse processes being quite rudimentary and the inferior articular surfaces being convex and turned outwards like those of the lumbar vertebrae. The smallest dorsal vertebra is the fourth. The vertebrae increase in size from that point downwards to the 12th and upwards to the first. The spinous processes also from the 8th downwards become shorter and are directed more horizontally. Characters of the lumbar vertebrae. The lumbar vertebrae, as shown in figure 6, are the largest segments of the vertebral column. The body is large, broad from side to side, flat above and below, and thicker before than behind. The pedicles are very strong, directed backwards, and the inferior intervertebral notches are of large size. The laminae are short but broad and strong, and the foramen triangular, larger than in the dorsal, smaller than in the cervical region. The superior articular processes are concave and directed backwards and inwards. The inferior convex and directed forwards and outwards. Projecting backwards from each of the superior articular processes is a tubercle, the representative of the transverse processes in the dorsal and cervical regions. The transverse processes are long, slender, directed a little backwards, and present at the posterior part of their base, a small tubercle which is directed downwards. The spinous processes are thick and broad, somewhat quadrilateral, horizontal in direction, and thicker below than above. The fifth lumbar vertebra is peculiar from having the body much thicker in front than behind, which accounts for the prominence of the sacrovertebral articulation. Structure of the vertebrae. The structure of a vertebra differs in different parts. The body is composed almost entirely of light, spongy, cancellous tissue having a thin coating of compact tissue on its external surface, permeated throughout its interior with large canals for the reception of veins, which converge towards a single large irregular or several small apertures at the posterior part of the body of each bone. The arch and processes projecting from it have, on the contrary, an exceedingly thick covering of compact tissue. Development. Each vertebra is formed of three primary centers of ossification, as shown in figure 7, one for each lamella and its processes, and one for the body. Those for the lamellae appear about the 6th week of fetal life, in the situation where the transverse processes afterwards project the ossific granules shooting backwards to the spine, forwards to the body, and outwards into the transverse and articular processes. That for the body makes its appearance in the middle of the cartilage about the 8th week. At birth, these three pieces are perfectly separate. During the first year, the lateral portions become partly united behind in the situation of the spinous process, and thus the arch is formed. About the third year, the body is joined to the arch on each side in such a manner that the body is formed from the three original centers of ossification. Before puberty, no other changes occur, excepting a gradual increase of growth of these primary centers, the upper and under surface of the bodies and the ends of the transverse and spinous process being tipped with cartilage in which ossific granules are not as yet deposited. At 16 years, as shown in figure 8, four secondary centers appear, one for the tip of each transverse process and two sometimes united into one for the spinous process. At 21 years, as shown in figure 9, two thin circular plates of bone are formed, one for the upper and one for the under surface of the body. All these bones become joined and the bone is completely formed about the 13th year of life. Exceptions to this mode of development occur in the first, second, and seventh cervical and in those of the lumbar region. The atlas, as shown in figure 10, is developed by three centers, one or sometimes two for the anterior arch and one for each lateral mass. The ossific centers for each lateral mass commence before birth. At birth, the anterior arch is altogether cartilaginous and the two lateral pieces are separated from one another behind. The nucleus for the anterior arch appears in the first year. Between the second and third years, the two lateral pieces unite and join the anterior part at the age of 5 or 6 years. There is frequently a separate epiphysis for the rudimentary spine. The axis, shown in figure 11, is developed by 5 centers, 3 for its anterior part and 2 for the posterior. The 3 anterior centers are one for the lower part of the body and 2 for the odontoid process and upper part of the body. The 2 posterior ones are one for each lamella. At about the 6th month of fetal life, those for the body and odontoid process make their appearance, the 2 for the odontoid process joining before birth. At birth, the bone consists of 4 pieces, 2 anterior and 2 lateral. At the 4th year, the body and odontoid process are completely joined. The 7th cervical. The anterior or costal part of the 7th transverse process of the 7th cervical is developed from a separate osseous center at about the 6th month of fetal life and joins the body and posterior division of the transverse process between the 5th and 6th years. Sometimes this process continues as a separate piece and becoming lengthened outwards constitutes what is known as a cervical rib. The lumbar vertebrae, as shown in figure 12, have 2 additional centers besides those peculiar to the vertebrae generally for the tubercles which project from the back part of the superior articular processes. The transverse process of the first lumbar is sometimes developed as a separate piece which may remain permanently unconnected with the remaining portion of the bone, thus forming a lumbar rib, a peculiarity which is sometimes, though rarely, met with. Progress of ossification in the spine generally. Ossification of the laminae of the vertebrae commences at the upper part of the spine and proceeds gradually downwards. Hence the frequent occurrence of spina bifida in the lower part of the spinal column. Ossification of the bodies, on the other hand, commences a little below the center of the spinal column and extends both upwards and downwards. Although, however, the ossific nuclei make their first appearance in the lower dorsal vertebrae about the 9th, the lumbar and first sacral are those in which these nuclei are largest at birth. The false vertebrae. The false vertebrae consist of 9 pieces which are united so as to form 2 bones, 5 entering into the formation of the sacrum, 4 the coccyx. The sacrum, as so shown in figure 13, is a large triangular bone situated at the lower part of the vertebral column and at the upper and back part of the pelvic cavity, where it is inserted like a wedge between the 2 ossa innominata. Its upper part or base articulating with the last lumbar vertebra, its apex with the coccyx. The sacrum is curved upon itself and placed very obliquely. Its upper extremity projecting forwards, forming with the last lumbar vertebra a very prominent angle called the promontory or sacrovertebral angle, whilst its central part is directed backwards so as to give increased capacity to the pelvic cavity. It presents for examination an anterior and posterior surveys two lateral surfaces, a base, an apex, and a central canal. The anterior surface is deeply concave from above downwards and slightly so from side to side. In the middle are seen four transverse lines indicating the original division of the bone into five separate pieces. The portions of bone intervening between the lines correspond to the bodies of the vertebrae. They are slightly concave longitudinally and diminish in size from above downwards. At the extremities of each of these lines are seen the anterior sacral foramina, analogous to the intervertebral foramina, four in number on each side, somewhat rounded in form, diminishing in size from above downwards and directed outwards and forwards. They transmit the anterior branches of the sacral nerves. External to these foramina is the lateral mass formed by the coalesced transverse processes of the sacral vertebrae, traversed by four broad shallow grooves which lodge the anterior sacral nerves as they pass outwards, the grooves being separated by prominent ridges of bone which give attachment to the slips of the piriformis muscle.
మొత్తం అంటుకోండి.
The posterior surface, as shown in figure 14, is convex and much narrower than the anterior. In the middle line are three or four tubercles, sometimes connected together, which represent the rudimentary spinous processes. Of these tubercles, the first is usually very prominent and perfectly separate from the rest. The second, third, and fourth existing either separate or united into a ridge which diminishes in size as it descends. The fifth and sometimes the fourth remaining undeveloped and exposing below the lower end of the sacral canal. External to the spinous processes on each side are the laminae, broad and well marked in the three first pieces, the lower part of the fourth and the whole of the fifth being undeveloped. In this situation, the sacral canal is exposed. External to the laminae are a linear series of indistinct tubercles representing the articular processes. The upper pair are well developed, the second and third are small, the fourth and fifth, usually blended together, are situated on each side of the sacral canal. They are called the sacral cornua and articulate with the cornua of the coccyx. External to the articular processes are the four posterior sacral foramina. They are smaller in size and less regular in form than the anterior and transmit the posterior branches of the sacral nerves. On the outer side of the posterior sacral foramina are a series of tubercles representing the rudimentary transverse processes. The first pair of transverse tubercles are very distinct and correspond with each superior angle of the bone. The second, small in size, enter into the formation of the iliac articulation, The third give attachment to the oblique sacroiliac ligaments. And the fourth and fifth to the great sacroischiatic ligaments. The interspace between the spinous and transverse processes of the sacrum presents a wide, shallow concavity called the sacral groove. It is continuous above with the vertebral groove and lodges the origin of the erector spinae. The lateral surface, broad above, becomes narrowed into a thin edge below. Its upper half presents in front a broad ear-shaped surface for articulation with the ilium. This is called the auricular or ear-shaped surface and in the fresh state is coated with cartilage. It is bounded posteriorly by deep and rough impressions for the attachment of the sacroiliac ligaments. The lower half is thin and sharp and gives attachment to the greater and lesser sacroischiatic ligaments. Below, it presents a deep notch which is converted into a foramen by articulation with the transverse process of the upper piece of the coccyx and transmits the anterior branch of the fifth sacral nerve. The base of the sacrum, which is broad and expanded, is directed upwards and forwards. In the middle is seen an oval articular surface which corresponds with the undersurface of the body of the last lumbar vertebra, bounded behind by the large triangular orifice of the sacral canal. This orifice is formed behind by the spinous process and laminae of the first sacral vertebra, whilst projecting from it on each side are the superior articular processes. They are oval, concave, directed backwards and inwards, like the superior articular processes of a lumbar vertebra in front of each articular process in an intervertebral notch, which forms the lower half of the last intervertebral foramen. Lastly, on each side of the articular surface is a broad and flat triangular surface of bone called the alae of the sacrum. They extend outwards and are continuous on each side with the iliac fossae. The apex, directed downwards and forwards, presents a small oval concave surface for articulation with the coccyx. The sacral canal runs throughout the greater part of the bone. It is large and triangular in form above, small and flattened from before backwards below. In this situation, its posterior wall is incomplete from the non-development of the laminae and spinous processes. It lodges the sacral nerves and is perforated by the anterior and posterior sacral foramina through which these pass out. Structure. It consists of much loose, spongy tissue within, invested externally by a thin layer of compact tissue. Differences in the sacrum of the male and female. The sacrum in the female is usually wider than in the male and it is much less curved, the upper half of the bone being nearly straight, the lower half presenting the greatest amount of curvature. The bone is also directed more obliquely backwards, which increases the size of the pelvic cavity and forms a more prominent sacrovertebral angle. In the male, the curvature is more evenly distributed over the whole length of the bone and is altogether greater than in the female. The peculiarities of the sacrum. This bone, in some cases, consists of 6 instead of 5 pieces. Occasionally, the number is reduced to 4. Sometimes, the bodies of the first and second vertebrae are not joined, or the laminae and spinous processes have not coalesced with the rest of the bone. Occasionally, the superior transverse tubercles are not joined to the rest of the bone on one or both sides. And lastly, the sacral canal may be open for nearly the lower half of the bone in consequence of the imperfect development of the laminae and spinous processes. The sacrum also varies considerably with respect to its degree of curvature. From the examination of a large number of skeletons, it would appear that in one set of cases, the anterior surface of this bone was nearly straight, the curvature, which was very slight, affecting only its lower end. In another set of cases, the bone was curved throughout its whole length, but especially towards its middle. In a third set, the degree of curvature was less marked and affected especially the lower third of the bone. Development of sacrum shown in figure 15. The sacrum, formed by the union of 5 vertebrae, has 35 centers of ossification. Each of the 3 first pieces is developed by 7 centers, with 3 for the body, 1 for its central part, 1 for each epiphyseal lamella on its upper and under surface, and 1 for each of the laminae. So far, the first 3 sacral vertebrae as well as the 2 last are developed like the other pieces of the vertebral column. One of the characteristic points in the development of this bone consists in the existence of 2 additional centers for each of the first 3 pieces, which appear one on each side close to the anterior sacral foramina and correspond to the transverse processes of the lumbar vertebrae. Each of the last, sorry, each of the 2 last pieces is developed by 5 centers, 3 for the body, with 1 for its central part, and 1 for each of the epiphyseal lamellae, and 1 for each of the laminae. A second characteristic point in the development of this bone consists in each lateral surface of the sacrum being developed by 2 epiphyseal points, one for the auricular surface and one for the thin lateral border of the bone. Period of development. At about the 8th or 9th week of fetal life, ossification of the central part of the bodies of the 3 first vertebrae commences, and at a somewhat later period, that of the 2 last. Between the 6th and 8th months, ossification of the lamellae takes place. And at about the same period, the characteristic osseous tubercles for the first 3 sacral vertebrae make their appearance. The lateral pieces join to form the arch and are united to the bodies first in the lowest vertebrae. This occurs about the 2nd year, the uppermost segment appearing as a single piece about the 5th or 6th year. About the 16th year, the epiphyseal lamellae for the bodies are formed, and between the 18th and 20th years, those for each lateral surface of the sacrum make their appearance. At about this period, the 2 last segments are joined to one another, and this process gradually extending upwards, all the pieces become united and the bone completely formed from the 25th to the 30th year of life. Articulations with 4 bones. The last lumbar vertebra, coccyx, and the 2 ossa innominata. Attachment of muscles. The piriformis and coccygeus on either side, behind the gluteus maximus and erector spinae. The coccyx. The coccyx, or from Greek meaning cuckoo, so called from resembling a cuckoo's beak, as shown in figure 16, is formed of 4 small segments of bone, the most rudimentary parts of the vertebral column. Of these, the first is the largest and often exists as a separate piece. The 3 last, diminishing in size from above downwards, are blended together so as to form a single bone. The gradual diminution in the size of the pieces gives this bone a triangular form, articulating by its base with the apex of the sacrum. It presents for examination an anterior and posterior surface, two borders, a base, and an apex. The anterior surface is slightly concave and marked with three transverse grooves indicating the points of junction of the different pieces. It has attached to it the anterior sacrococcygeal ligament and levator ani muscle and supports the lower end of the rectum. The posterior surface is convex, marked by grooves similar to those on the anterior surface, and presents on each side a linear row of tubercles which represent the articular processes of the coccygeal vertebrae. Of these, the superior pair are often large. They are called the cornua of the coccyx and projecting upwards articulate with the cornua of the sacrum, the junction between these two bones completing the fifth foramen for the transmission of the posterior branch of the fifth sacral nerve. The lateral borders are thin and present a series of small eminences which represent the transverse processes of the coccygeal vertebrae. Of these, the first on each side is of large size, flattened from before backwards, and often ascends upwards to join the lowest part of the thin lateral edge of the sacrum, thus completing the fifth sacral foramen. The others diminish in size from above downwards and are often wanting. The borders of the coccyx are narrow and give attachment on each side to the sacrosciatic ligaments and coccygeus muscle. The base presents an oval surface for articulation with the sacrum. The apex is rounded and has attached to it the tendon of the external sphincter ani muscle. It is occasionally bifid and sometimes deflected to one or other side. Development. The coccyx is developed by four centers. Development. The coccyx is developed by four centers, one for each piece. Occasionally, one of the three first pieces of this bone is developed by two centers placed side by side. The periods when the ossific nuclei make their appearance is the following. In the first segment at birth, in the second piece at from 5 to 10 years, in the third from 10 to 15 years, in the fourth from 15 to 20 years. As age advances, these various segments become united in the following order. The two first pieces join, then the third and fourth, and lastly, the bone is completed by the union of the second and third. At a late period of life, especially in females, the coccyx becomes joined to the end of the sacrum. Articulation with the sacrum. Attachment of muscles on either side, the coccygeus, behind the gluteus maximus, at its apex the sphincter ani, and in front the levator ani. Of the spine in general, the spinal column formed by the junction of the vertebrae is situated in the medial line at the posterior part of the trunk. Its average length is about 2 feet 2 or 3 inches. The lumbar region contributing 7 parts, the dorsal 11 and the cervical 5. Viewed in front, it presents two pyramids joined together at their bases, the upper one being formed by all the true vertebrae from the second cervical to the last lumbar, the lower one by the false vertebrae, the sacrum and coccyx. Viewed somewhat more closely, the uppermost pyramid is seen to be formed of 3 smaller pyramids. Of these, the most superior one consists of the 6 lower cervical vertebrae, its apex being formed by the axis or second cervical, its base by the first dorsal. The second pyramid, which is inverted, is formed by the 4 upper dorsal vertebrae, the base being at the first dorsal, the smaller end at the fourth. The third pyramid commences at the fourth dorsal and gradually increases in size to the fifth lumbar. Viewed laterally, as shown in figure 17, the spinal column presents several curves. In the dorsal region, the seat of the principal curvature, the spine is concave anteriorly, whilst in the cervical and lumbar regions, it is convex anteriorly, especially in the later. The spine has also a slight lateral curvature, the convexity of which is directed towards the right side. This is most probably produced, as Bichat first explained, from the effect of muscular action. Most persons using the right arm in preference to the left, especially in making long continued efforts when the body is curved to the right side. In support of this explanation, it has been found by Blacklard that in 1 or 2 individuals who were left-handed, the lateral curvature was directed to the left side. The spinal column presents for examination an anterior, a posterior, and 2 lateral surfaces, a base, summit, and vertebral canal. The anterior surface presents the bodies of the vertebrae separated in the fresh state by the intervertebral discs. The bodies are broad in the cervical region, narrow in the upper part of the dorsal, and broadest in the lumbar region. The whole of this surface is convex transversely, concave from above downwards in the dorsal region, and convex in the same direction in the cervical and lumbar regions. The posterior surface presents in the median line the spinous processes. These are short, horizontal, with bifid extremities in the cervical region. In the dorsal region, they are directed obliquely above, assume almost a vertical direction in the middle, and are horizontal like the spines of the lumbar vertebrae below. They are separated by considerable intervals in the loins, by narrower intervals in the neck, and are closely approximated in the middle of the dorsal region. On either side of the spinous processes, extending the whole length of the column, is the vertebral groove formed by the laminae in the cervical and lumbar regions, where it is shallow, and by the laminae and transverse processes in the dorsal region, where it is deep and broad. In the recent state, these grooves lodge the deep muscles of the back. External to the vertebral grooves are the articular processes, and still more externally the transverse processes. In the dorsal region, these latter processes stand backwards on a place considerably posterior to the same processes in the cervical and lumbar regions. The transverse processes in certain regions of the spine are formed of 2 different parts or segments. In the cervical region, these 2 segments are distinct. The one arising from the side of the body, the other from the pedicle of the vertebra, and these uniting enclose the vertebral foramen. In the dorsal region, the anterior segment is wanting, the posterior segment retaining the name of the transverse process. In the lumbar region, the anterior segments, which are largely developed, are called the transverse processes, but in reality, they are lumbar ribs. The posterior segments are true transverse processes existing in a rudimentary state and being developed from the superior articular processes as in the cervical region. In the cervical region, the transverse processes are placed in front of the articular processes and between the intervertebral foramina. In the lumbar, they are placed also in front of the articular processes but behind the intervertebral foramina. In the dorsal region, they are posterior both to the articular processes and foramina. The lateral surfaces are separated from the posterior by the articular processes in the cervical and lumbar regions and by the transverse processes in the dorsal. These surfaces present in front the sides of the bodies of the vertebrae, marked in the dorsal region by the facets for articulation with the heads of the ribs. More posteriorly are the intervertebral foramina formed by the juxtaposition of the intervertebral notches, oval in shape, smallest in the cervical and upper part of the dorsal regions, and gradually increasing in size to the last lumbar. They are situated between the transverse processes in the neck and in front of them in the back and loins and transmit the spinal nerves. The base of the vertebral column is formed by the undersurface of the body of the fifth lumbar vertebra and the summit by the upper surface of the atlas. The vertebral canal follows the different curves of the spine. It is largest in those regions in which the spine enjoys the greatest freedom of movement, as in the neck and loins, where it is wide and triangular, and narrow and rounded in the back, where motion is more limited. The skull. The skull is divided into two parts, the cranium and the face. The cranium is composed of 8 bones, viz. The occipital, 2 parietal, frontal, 2 temporal, sphenoid, and ethmoid. The face is composed of 14 bones, viz. The 2 nasal, 2 superior maxillary, 2 lacrimal, 2 malar, 2 palate, 2 inferior turbinated, vomer, inferior maxillary. The ossicula auditus, the teeth, and vermian bones are not included in this enumeration. The occipital bone. The occipital bone, as shown in figure 18, is situated at the posterior and inferior part of the cranium, is trapezoid in form, curved upon itself, and presents for examination 2 surfaces, 4 borders, and 4 angles. External surface. Midway between the summit of the bone and the posterior margin of the foramen magnum is a prominent tubercle, the external occipital protuberance for the attachment of the ligamentum nuchae, and descending from it as far as the foramen, a vertical ridge, the external occipital crest. Passing outwards from the occipital protuberance on each side are 2 semicircular ridges, the superior curved lines, and running parallel with these from the middle of the crest are the 2 inferior curved lines. The surface of the bone above the superior curved lines presents on each side a smooth surface which in the recent state is covered by the occipitofrontalis muscle, whilst the ridges as well as the surfaces of the bone between them serve for the attachment of numerous muscles. The superior curved line gives attachment internally to the trapezius, externally to the occipitofrontalis and sternocleidomastoideus, to the extent shown in the figure. The depressions between the curved lines to the complexus internally, the splenius capitis and obliquus superior externally. The inferior curved line and the depressions below it afford insertion to the rectus capitis posticus, major and minor. The foramen magnum is a large aperture with rounded shelving margins, oblong in form and wider behind than in front. It transmits the spinal cord and its membranes, the spinal accessory nerves, and the vertebral arteries. On each side of the foramen magnum are the occipital condyles for articulation with the atlas. They are convex articular surfaces, oval in form and directed downwards and outwards. They approach each other anteriorly and encroach more upon the anterior than the posterior segment of the foramen. On their inner surface is a rough tubercle for the attachment of the check ligaments, whilst external to them is a tough tubercular prominence, the transverse or jugular process, channeled in front by a deep notch, which forms part of the jugular foramen. The undersurface of this process affords attachment to the rectus capitis lateralis muscle. Its upper or cerebral surface presents a deeply curved groove which lodges part of the lateral sinus, whilst its prominent extremity is marked by a quadrilateral rough surface covered with cartilage in the fresh state and articulating with a similar surface on the petrous portion of the temporal bone. On the outer on the outer side of each condyle is a depression, the anterior condyloid fossa, perforated at the bottom by the anterior condyloid foramen. This foramen, which occurs sometimes in the double, is directed downwards, outwards, and forwards and transmits the lingual nerve. Behind each condyle is seen an irregular fossa, also perforated at the bottom by a foramen, the posterior condyloid, for the transmission of a vein to the lateral sinus. This fossa and foramen are less regular in form and size than the anterior and do not always exist. Sometimes they are found on one side only and sometimes are altogether absent. In front of the foramen magnum is the basilar process, somewhat quadrilateral in form, wider behind than in front. Its undersurface, which is rough, presenting in the median line a tubercular ridge, the pharyngeal spine, for the attachment of the tendinous raphe and superior constrictor of the pharynx. And on each side of it, rough depressions for the upper attachment of the recti capitis antici, major and minor. The internal or cerebral surface, as shown in figure 19, is deeply concave. The occipital part is divided by a crucial ridge into 4 fossae. The two superior, the smaller, receive the posterior lobes of the cerebrum and present eminences and depressions corresponding to their convolutions. The two inferior, which receive the lateral lobes of the cerebellum, are larger than the former and comparatively smooth. Both are marked by slight grooves for the lodgement of arteries. At the point of meeting of the 4 divisions of the crucial ridge is an eminence, the internal occipital protuberance, which rarely corresponds to that on the outer surface. From this eminence, the superior division of the crucial ridge, called circus longitudinalis, runs upwards to the superior angle of the bone. It presents a deep groove for the superior longitudinal sinus, whilst its margins give attachment to the falx cerebri. The inferior division, the internal occipital crest, runs to the margin of the foramen magnum, on the edge of which it becomes generally lost. This ridge, which is bifurcated below, serves for the attachment of the falx cerebelli and is slightly grooved for the lodgement of the occipital sinuses. The transverse grooves, which are called sulci transversalis, pass outwards to the lateral angles. They are deeply grooved for the lodgement of the lateral sinuses, their prominent margins affording attachment to the tentorium cerebelli. At the point of meeting of these four grooves is a depression for the torcular herophily, placed a little to the right of the internal occipital protuberance. In the center of the basilar portion of the bone is the foramen magnum, and above its margin, both nearer its anterior than its posterior part, the internal openings of the anterior condyloid foramina. The internal openings of the posterior condyloid foramina being a little external and posterior to them and protected above by a small arch of bone. In front of the foramen magnum is the basilar process presenting a shallow longitudinal depression, the basilar groove for supporting the medulla oblongata. Whilst on its lateral margins is observed a narrow channel on each side, which, when united with a similar channel on the petrous portion of the temporal bone, forms a groove, the inferior petrosal, which lodges the inferior petrosal sinus. Angles. The superior angle is acute and is received into the interval between the posterior superior angles of the two parietal bones. It corresponds with that part of the head in the fetus which is called the posterior fontanelle. The inferior angle is represented by the square-shaped surface of the basilar process. At an early period of life, a layer of cartilage separates this part of the bone from the sphenoid, but in the adult, the union between them is osseous. The lateral angles correspond to the outer ends of the transverse grooves and are received into the interval between the posterior inferior angles of the parietal and the mastoid portion of the temporal. Borders. The superior extends on each side from the superior to the lateral angle is deeply serrated for articulation with the parietal bone and forms by this union the lambdoid suture. The inferior border extends from the lateral to the inferior angle. Its upper half is rough and articulates with the mastoid portion of the temporal, forming the masto-occipital suture. The inferior half articulates with the petrous portion of the temporal, forming the petro-occipital suture. These two portions are separated from one another by the jugular process. In front of this process is a notch which, with a similar one on the petrous portion of the temporal, forms the foramen lacerum posterius. This notch is often subdivided into two parts by a small process of bone. Structure. The occipital bone consists of two compact laminae called the outer and inner tables, having between them the diploic tissue. This bone is especially thick at the ridges, protuberances, condyles, and basilar process, whilst at the bottom of the fossae it is thin, semi-transparent, and destitute of diplo. Development. Figure 20. The occipital bone has 7 centers of development, 4 for the posterior or occipital part, 1 for the basilar portion, and 1 for each condyloid portion. The 4 centers for the occipital portion are arranged in pairs above and below the occipital protuberance and appear about the 10th week of fetal life. The inferior pair make their appearance first and join. The superior pair become also united. These two segments now join together and form a single piece. The condyloid portions then ossify, and lastly, the basilar portion. At birth, the bone consists of these 4 parts, separate from one another, the posterior being fissured in the direction of the original segments. At about the fourth year, the occipital and the two condyloid pieces join, and at about the sixth year, the bone consists of a single piece. At a later period, between the 18th and 25th years, the occipital and sphenoid become united, forming a single bone. Articulations. With six bones, two parietal, two temporal, sphenoid, and atlas. Attachment of muscles. To the superior curved line are attached the occipitofrontalis, trapezius, and sternocleidomastoid. To the space between the curved lines, the complexus, splenius capitis, and obliquus anterior. To the inferior curved line and the space between it and the foramen magnum, the rectus posticus major and minor. To the transverse process, the rectus lateralis. And to the basilar process, the recti antici majoris and minoris and superior constrictor of the pharynx. The parietal bones. The parietal bones form the sides and roof of the skull. They are of an irregular quadrilateral form and present for examination two surfaces, four borders, and four angles. Surfaces. The external surface, as shown in figure 21, is convex, smooth, and presents about its center an eminence called the parietal eminence, which indicates the point where ossification commenced. Crossing the center of the bone in an arched direction is a curved ridge, the temporal ridge for the attachment of the temporal fascia. Above this ridge, the surface of the bone is rough and porous and covered by the aponeurosis of the occipitofrontalis. Below it, the bone is smooth and affords and affords attachment to the temporal muscle. At the back part of the superior border is a small foramen, the parietal foramen, which transmits a vein to the superior longitudinal sinus. Its existence is not constant and its position varies considerably. The internal surface, as shown in figure 22, concave, presents numerous eminences and depressions for lodging the convolutions of the brain and minute furrows for the ramifications of the meningeal arteries. These run upwards and backwards from deep grooves which commence in the anterior inferior angle and at the central and posterior part of the lower border of the bone. Along the upper margin is part of a shallow groove which, when joined to the opposite parietal, forms a channel for the superior longitudinal sinus, the elevated edges of which afford attachment to the falx cerebri. Near the groove are seen several depressions. They lodge the pacchionian bodies. The internal opening of the parietal foramen is also seen when that aperture exists. Borders. The superior, the longest, is dentated to articulate with its fellow of the opposite side, forming the sagittal suture. The inferior is divided into three parts. Of these, the anterior is thin and pointed, beveled at the expense of the outer surface, and overlapped by the tip of the great wing of the sphenoid. The middle portion is arched, beveled at the expense of the outer surface, and overlapped by the squamous portion of the temporal, the posterior portion being thick and serrated for articulation with the mastoid portion of the temporal. The anterior border, deeply serrated, is beveled at the expense of the outer surface above and of the inner below. It articulates with the frontal bone, forming the coronal suture. The posterior border, deeply denticulated, articulates with the occipital, forming the lambdoid suture. Angles. The anterior superior thin and pointed, corresponds with that portion of the skull which in the fetus is membranous and is called the anterior fontanelle. The anterior inferior angle is thin and lengthened, being received in the interval between the great wing of the sphenoid and the frontal. Its inner surface is marked by a deep groove, sometimes a canal, for the middle meningeal artery. The posterior superior angle corresponds with the junction of the sagittal and lambdoid sutures. In the fetus, this part of the skull is membranous and is called the posterior fontanelle. The posterior inferior articulates with the mastoid portion of the temporal bone and presents on its inner surface a broad shallow groove for the lateral sinus. Development. The parietal bone is developed by one center, which corresponds with the parietal eminence and makes its first appearance about the 5th or 6th week of fetal life. Articulations with 5 bones: the opposite parietal, the occipital, frontal, temporal, and sphenoid. Attachment of muscles to one only, the temporal. The frontal bone. This bone, which resembles a cockle shell in form, consists of 2 portions, a vertical or frontal portion situated at the anterior part of the cranium, forming the forehead, and a horizontal or orbitonasal portion, which enters into the formation of the roof of the orbits and nose. Vertical portion. External surface as shown in figure 23. In the median line traversing the bone from the upper to its lower part is a slightly elevated ridge, and in young subjects a suture which represents the point of union of its 2 lateral halves. In the adult, this suture usually disappears. On either side of this ridge, a little below the center of the bone, is a rounded eminence, the frontal eminence, which indicates the point where ossification commenced. The whole surface of the bone above this part is smooth and covered by the aponeurosis of the occipitofrontalis muscle. Below the frontal protuberance and separated from it by a slight groove is the superciliary ridge, a curved eminence, broad internally where it is continuous with the nasal eminence, less distinct externally as it arches outwards. Beneath the superciliary ridge is the supraorbital arch, a curved and prominent margin which forms the upper boundary of the orbit and separates the vertical from the horizontal portion of the bone. At the inner third of this arch is a notch, sometimes converted into a foramen by a bony process or ligament, and called the supraorbital notch or foramen. It transmits the supraorbital artery, veins, and nerve. The supraorbital arch terminates externally in the external angular process and internally in the internal angular process. The external angular is a strong, prominent process which articulates with the malar. Running upwards and backwards from it is a sharp curved line, the temporal ridge, for the attachment of the temporal fascia, and beneath it a slight concavity that forms part of the temporal fossa and gives origin to the temporal muscle. The internal angular processes are less marked than the external and articulate with the lacrimal bones. Between the two is a rough, uneven interval called the nasal notch, which articulates in the middle line with the nasal and on either side with the nasal process of the superior maxillary bones. Vertical portion. Internal surface as shown in figure 24. Along the middle line of this surface is a vertical groove, sulcus longitudinalis, the edges of which unite below to form a ridge, the frontal crest. The groove lodges the superior longitudinal sinus, whilst its edges afford attachment to the falx cerebri. The crest terminates below at a small opening, the foramen cecum, which is generally completed behind by the ethmoid. It lodges a process of the falx cerebri and occasionally transmits a small vein from the nose to the superior longitudinal sinus. On either side of the groove, the bone is deeply concave, presenting eminences and depressions for the convolutions of the brain, and numerous small furrows for lodging the ramifications of the anterior meningeal arteries. Several small, irregular fossae are also seen on either side of the groove for the reception of the Pacchionian bodies. Horizontal portion. External surface. This portion of the bone consists of two thin plates which form the vault of the orbits, separated from one another by the ethmoidal notch. Each orbital vault consists of a smooth, concave, triangular plate of bone marked at its anterior and external part immediately beneath the external angular process by a shallow depression, the lacrimal fossa, for lodging the lacrimal gland, and at its anterior and interior internal part by a depression, sometimes a tubercle, for the attachment of the fibrous pulley of the superior oblique muscle. The ethmoidal notch separates the two orbital plates. It is quadrilateral and filled up when the bones are united by the cribriform plate of the ethmoid. The edges of this notch present several half cells which, when united with corresponding half cells on the upper surface of the ethmoid, complete the ethmoidal cells. Two grooves are also seen crossing these edges transversely. They are converted into canals by articulations with the ethmoid and are called anterior and posterior ethmoidal canals. They open on the inner wall of the orbit. In front of the ethmoidal notch is the nasal spine, a sharp eminence which projects downwards and forwards, and the grooved base of which forms part of the roof of the nose. It articulates in front with the crest of the nasal bones, behind with the perpendicular plate of the ethmoid. On either side of this spine are the openings of the frontal sinuses. These are two irregular cavities which extend upwards and outwards a variable distance between the two tables of the skull and are separated from one another by a thin bony septum. They give rise to the prominences above the root of the nose called the nasal eminences. In the child, they are absent and they become gradually developed as age advances. They are lined by mucous membrane and communicate with the nose by the infundibulum. The internal surface of the horizontal portion presents the convex upper surfaces of the orbital plates separated from each other in the middle line by the ethmoidal notch and marked by eminences and depressions for the convolutions of the anterior lobes of the brain. Borders. The border of the vertical portion is thick, strongly serrated, beveled at the expense of the internal table above, where it rests upon the parietal, at the expense of the external table at each side, where it receives the lateral pressure of those bones. This border is continued below into a triangular rough surface which articulates with the great wing of the sphenoid. The border of the horizontal portion is thin, beveled at the expense of the internal table, and articulates with the lesser wing of the sphenoid. Structure. The vertical portion consists of diploid tissue contained between two compact laminae, the bone being especially thick in the situation of the nasal eminences and external angular processes. The horizontal portion is thinner, more translucent, and composed entirely of compact tissue. Development. The frontal bone is developed by two centers, one for each lateral half, which make their appearance at an early period of fetal life in the situation of the orbital arches. At birth, it consists of two pieces, which afterwards become united along the middle line by a suture which runs from the vertex to the root of the nose. This suture becomes obliterated within a few years after birth, but it occasionally remains throughout life. Articulations. With 12 bones, 2 parietal, sphenoid, ethmoid, 2 nasal, 2 superior maxillary, 2 lacrimal, and 2 malar. Attachment of muscles to 3 pairs, the corrugator supercilii, orbicularis palpebrarum, and temporal. The temporal bones. The temporal bones, situated at the side and base of the skull, present for examination a squamous, mastoid, and petrous portion. The squamous portion, as shown in figure 25, the most anterior and superior part of the bone, is flattened and scale-like in form, thin and translucent in texture. Its outer surface is smooth, convex, and grooved for the deep temporal arteries. It affords attachment to the fibers of the temporal muscle and forms part of the temporal fossa. At its back part may be seen a curved ridge, part of the temporal ridge. It serves for the attachment of the temporal fascia, limits the origin of the temporal muscle, and marks the boundary between the squamous and mastoid portions of the bone. Projecting from the lower part of the squamous portion is a long and arched process of bone, the zygomatic process. It is at first directed outwards, its two surfaces looking upwards and downwards. It then appears as if twisted upon itself and takes a direction forwards, its surface now looking inwards and outwards. The superior border of this process is long, thin, and sharp and serves for the attachment of the temporal fascia. The inferior, short, thick, and arched, has attached to it some of the fibers of the masseter muscle. Its outer surface is convex and subcutaneous. Its inner concave also affords attachment to the masseter. The extremity, broad and deeply serrated, articulates with the malar bone. This process is connected to the temporal bone by 3 divisions called the roots of the zygomatic process, an anterior, middle, and posterior. The anterior, which is short but broad and strong, runs transversely inwards into a rounded eminence, the eminentia articularis. This eminence forms the front boundary of the glenoid fossa and in the recent state is covered with cartilage. The middle root runs obliquely inwards and terminates at the edge of a well-marked fissure, the Glaserian fissure, whilst the posterior, which is strongly marked, runs from the upper border of the zygoma in an arched direction upwards and backwards, forming the posterior part of the temporal ridge. At the junction of the anterior and middle roots is a projection called the tubercle for the attachment of the external lateral ligament of the lower jaw. And between these roots is a large oval depression forming part of the glenoid fossa for the reception of the condyle of the lower jaw. This fossa is bounded in front by the eminentia articularis, behind by the vaginal process, and externally by the auditory process, and is divided into two parts by a narrow slit, the Glaserian fissure. The anterior part, formed by the squamous portion of the bone, is smooth, covered in the recent state with cartilage, and articulates with the condyle of the lower jaw. The posterior part, rough and uneven, and formed chiefly by the vaginal process of the petrous portion, largest part of the parotid gland. The Glaserian fissure, dividing the two, leads into the tympanum. It lodges the processus gracilis of the malleus and transmits the laxator tympani muscle and the anterior tympanic artery. The chorda tympani nerve passes through a separate canal parallel to the Glaserian fissure on the outer side of the eustachian tube in the retiring angle between the squamous and petrous portions of the temporal bone. The internal surface of the squamous portion, as shown in figure 26, is concave, presents numerous eminences and depressions for the convolutions of the cerebrum, and two well-marked grooves for the branches of the middle meningeal artery. Borders. The superior border is thin, beveled at the expense of the internal surface so as to overlap the lower border of the parietal bone, forming the squamous suture. The anterior inferior border is thick, serrated, and beveled alternately at the expense of the inner and outer surfaces for articulation with the great wing of the sphenoid. The mastoid portion is situated at the posterior part of the bone. Its outer surface is rough and perforated by numerous foramina. One of these, of large size, situated at the posterior border of the bone, is termed the mastoid foramen. It transmits a vein to the lateral sinus and a small artery. The position and size of this foramen are very variable, being sometimes situated in the occipital bone or in the suture between it and the occipital. The mastoid portion is continued below into a conical projection, the mastoid process, the size and form of which varies considerably in different individuals. This process serves for the attachment of the sternomastoid, splenius capitis, and tracheomastoid. See figure 25. On the inner side of the mastoid process is a deep groove, the digastric fossa, for the attachment of the digastric muscle, and running parallel with it but more internal, the occipital groove which lodges the occipital artery. The internal surface presents a deeply curved groove which lodges the lateral sinus, and into it may be seen opening the mastoid foramen. Borders. The superior border of the mastoid portion is rough and serrated for articulation with the posterior inferior angle of the parietal bone. The posterior border, also uneven and serrated, articulates with the inferior border of the occipital bone between its lateral angle and jugular process. The petrous portion, so named from its extreme density and hardness, is a pyramidal process of bone wedged in at the base of the skull between the sphenoid and occipital bones. Its direction from without is forwards, inwards, and a little downwards. It presents for examination a base, an apex, three surfaces, and three borders. The base is applied against the internal surface of the squamous and mastoid portions, its upper half being concealed, but its lower half is exposed by their divergence, which brings into view the oval expanded orifice of a canal leading into the tympanum, the meatus auditorius externus. This canal is situated between the mastoid process and the posterior and middle roots of the zygoma. Its upper margin is smooth and rounded, its lower surrounded by a curved plate of bone, the auditory process, the free margin of which is rough for the attachment of the cartilage of the ear. The apex of the petrous portion, rough and uneven, is received into the angular interval between the spinous process of the sphenoid and the basilar process of the occipital. It presents the anterior orifice of the carotid canal and forms the posterior and external boundary of the foramen lacerum medium. The anterior surface, figure 26, of the petrous portion forms the posterior boundary of the middle fossa of the skull. This surface is continuous with the squamous portion, to which it is united by a suture, the temporal suture, the remains of which are distinct at a later period of life. Proceeding from the base to the apex, this surface presents 5 points for examination. Number 1, an eminence which indicates the situation of the superior semicircular canal. Number 2, a shallow groove, sometimes double, leading backwards to an oblique opening, the hiatus fallopi, for the passage of the petrosal branch of the Vidian nerve. Number 3, a small opening immediately beneath and external to the latter for the passage of the smaller petrosal nerve. Number 4, near the apex of the bone is seen the termination of the carotid canal, the wall of which in this situation is deficient in front. Above the foramen is a shallow depression for the reception of the Gasserian ganglion. The posterior surface forms the front boundary of the posterior fossa of the skull and is continuous with the inner surface of the mastoid portion of the bone. It presents 3 points for examination. Number 1, about its center is a large orifice, the meatus auditorius internus. This aperture varies considerably in size. Its margins are smooth and rounded, and it leads into a short and oblique canal which is directed outwards and forwards. It transmits the auditory and facial nerves and auditory artery. Behind the meatus auditorius is a small slit almost hidden by a thin plate of bone and leading to a canal, the aqueductus vestibuli. It transmits a small artery and vein and lodges a process of the dura mater. 3. In the interval between these two openings, but above them, is an angular depression which lodges a process of the dura mater and transmits a small vein into the cancellous tissue of the bone. The inferior or basilar surface, as shown in figure 27, is rough and irregular and forms part of the base of the skull. Passing from the apex to the base, this surface presents 11 points for examination. Number 1, a rough surface, quadrilateral in form, which serves partly for the attachment of the levator palati and tensor tympani muscles. The opening of the carotid canal, a large circular aperture, which ascends at first vertically upwards and then making a bend, runs horizontally forwards and inwards. It transmits the internal carotid artery and the carotid plexus. Number 3, the aqueductus cochleae, a small triangular opening lying on the inner side of the later, close to the posterior border of the bone. It transmits a vein from the cochlea which joins the internal jugular. 4. Behind these openings is a depression, the jugular fossa, which varies in depth and size in different skulls. It lodges the internal jugular vein and with a similar depression on the margin of the occipital bone forms the foramen lacerum posterius. A small foramen for the passage of Jacobson's nerve, the tympanic branch of the glossopharyngeal. This is seen on the ridge of bone dividing the carotid canal from the jugular fossa. The canal for Arnold's nerve seen on the inner wall of the jugular fossa. Number 7. Behind the jugular fossa is a smooth square-shaped facet, the jugular surface, which articulates with the jugular process of the occipital bone. 8. The vaginal process, a very broad sheath-like plate of bone which extends from the carotid canal to the mastoid process. It divides behind into two laminae, receiving between them the ninth point for examination, the styloid process. A long, sharp spine, about an inch in length, continuous with the vaginal process, between the laminae of which it is received and directed downwards, forwards, and inwards. It affords attachment to three muscles, the stylopharyngeus, styloglossus, and stylohyoideus, and two ligaments, the stylohyoid and stylomaxillary. The stylomastoid foramen, a rather large orifice placed between the styloid and mastoid processes. It is the termination of the aqueductus fallopi and transmits the facial nerve and stylomastoid artery. The auricular fissure situated between the vaginal and mastoid process and transmitting the auricular branch of the pneumogastric nerve. Borders. The superior, the longest, is grooved for the superior petrosal sinus and has attached to it the tentorium cerebelli. At its inner extremity is a semilunar notch upon which reclines the fifth nerve. The posterior border is intermediate in length between the superior and the anterior. Its inner half is marked by a groove which, when completed by its articulation with the occipital, forms the channel for the inferior petrosal sinus. Its outer half presents a deep excavation for the jugular fossa, which, with a similar notch on the occipital, forms the foramen lacerum posterius. A projecting eminence of bone occasionally stands out from the center of the notch and divides the foramen into two parts. The anterior border is divided into two parts, an outer, joined to the squamous portion by a suture, the remains of which are distinct, an inner, free, articulating with the spinous process of the sphenoid. At the angle of junction of these two parts are seen two canals separated from one another by a thin plate of bone, the processus cochleariformis. They both lead into the tympanum, the upper one transmitting the tensor tympani muscle, the lower one the eustachian tube. Structure. The squamous portion is like that of the other cranial bones, the mastoid portion cellular, and the petrous portion dense and hard. Development shown in figure 28. The temporal bone is developed by four centers, exclusive of those for the internal ear and the ossicula, viz. One for the squamous portion, including the zygoma, one for the petrous and mastoid parts, one for the styloid, and one for the auditory process. or the tympanic bone. The first traces of the development of this bone are found in the squamous portion. They appear about the time when osseous matter is deposited in the vertebrae. The auditory process succeeds next. It consists of an elliptical portion of bone forming about 3/4 of a circle, the deficiency being above. It is grooved along its concave surface for the attachment of the membrana tympani and becomes united by its extremities to the squamous portion during the last months of intrauterine life. The petrous and mastoid portions then become ossified, and lastly, the styloid process, which remains separate a considerable period and is occasionally never united to the rest of the bone. At birth, the temporal bone, excluding the styloid process, is formed of three pieces: the squamous and zygomatic, the petrous and mastoid, and the auditory. The auditory process joins with the squamous at about the 9th month. The petrous and mastoid join with the squamous during the first year, and the styloid process becomes united between the second and third years. The subsequent changes in this bone are the extension outwards of the auditory process so as to form the meatus auditorius. The glenoid fossa becomes deeper, and the mastoid part enlarges from the development of numerous cellular cavities in its interior. Articulations with 5 bones: occipital, parietal, sphenoid, inferior maxillary, and malar. Attachment of muscles to the squamous portion, the temporal; to the zygoma, the masseter; to the mastoid portion, the occipitofrontalis; sternomastoid, splenius capitis, tracheomastoid, digastricus, and retrahens aurum; to the styloid process, the stylopharyngeus, stylohyoideus, and styloglossus; and to the petrous portion, the levator palati, tensor tympani, and stapedius. The sphenoid bone. The sphenoid, in Greek, sphen, a wedge, eidos like, is situated at the anterior part of the base of the skull, articulating with all the other cranial bones, which it binds firmly and solidly together. In its form, it somewhat resembles a bat with its wings extended, and is divided into a central portion or body, two greater and two lesser wings extending outwards on each side of the body, and two processes, the pterygoid processes, which project from it below. The body presents for examination 4 surfaces: a superior, an inferior, an anterior, and a posterior. The superior surface is shown in figure 29. From before backwards is seen a prominent spine, the ethmoidal spine, for articulation with the ethmoid. Behind this, a smooth surface presenting in the median line a slight longitudinal eminence with a depression on each side for lodging the olfactory nerves. A narrow transverse groove, the optic groove, bounds the above-mentioned surface behind. It lodges the optic commissure and terminates on either side in the optic foramen for the passage of the optic nerve and ophthalmic artery. Behind the optic groove is a small eminence, olive-like in shape, the olivary process, and still more posteriorly a deep depression, the pituitary fossa or sella turcica, which lodges the pituitary body. This fossa is perforated by numerous foramina for the transmission of nutrient vessels to the substance of the bone. It is bounded in front by 2 small eminences, one on either side, called the middle clinoid processes, and behind by a square-shaped plate of bone terminating at each superior angle in a tubercle, the posterior clinoid processes, the size and form of which vary considerably in different individuals. The sides of this plate of bone are notched below for the passage of the 6th pair of nerves, and behind it presents a shallow depression which slopes obliquely backwards and is continuous with the basilar groove of the occipital bone. It supports the medulla oblongata. On either side of the body may be seen a broad groove curved somewhat like the italic letter S. It lodges the internal carotid artery and the cavernous sinus and is called the cavernous groove. The posterior surface, quadrilateral in form, articulates with the basilar process of the occipital bone. During childhood, a separation between these bones exists by means of a layer of cartilage. But in afterlife, this becomes ossified and the two bones are immovably connected together. The anterior surface, shown in figure 30, presents in the middle line a vertical lamella of bone which articulates in front with the perpendicular plate of the ethmoid. On either side of it are the irregular openings leading into the sphenoidal sinuses. These are two large irregular cavities hollowed out of the interior of the body of the sphenoid bone and separated from one another by a more or less complete perpendicular septum. Their form varies considerably, being often subdivided by irregular osseous laminae. These sinuses do not exist in children, but they increase in size as age advances. They are partially closed in front and below by two thin triangular plates of bone, the sphenoidal turbinated bones, leaving a round opening at their upper parts by which they communicate with the upper and back part of the nose and occasionally with the posterior ethmoidal cells. The lateral margins of this surface present a serrated edge which articulates with the os planum of the ethmoid, completing the posterior ethmoidal cells. The lower margin, also rough and serrated, articulates with the orbital process of the palate bone and the upper margin with the orbital plate of the frontal bone. The inferior surface presents in the middle line a triangular spine, the rostrum, which is continuous with the vertical plate on the anterior surface and is received into a deep fissure between the alae of the vomer. On each side may be seen a projecting lamina of bone which runs horizontally inwards from near the base of the pterygoid process. These plates, termed the vaginal processes, articulate with the edges of the vomer. Close to the root of the pterygoid process is a groove formed into a complete canal when articulated with the sphenoidal process of the palate bone. It is called the pterygopalatine canal and transmits the pterygopalatine vessels and pharyngeal nerve. The greater wings are two strong processes of bone which arise at the sides of the body and are curved in a direction upwards, outwards, and backwards, being prolonged behind into a sharp pointed extremity called the spinous process of the sphenoid. Each wing presents three surfaces and a circumference. The superior or cerebral surface forms part of the middle fossa of the skull. It is deeply concave and presents eminences and depressions for the convolutions of the brain. At its anterior and internal part is seen a circular aperture, the foramen rotundum, for the transmission of the second division of the fifth nerve. Behind and external to this, a large oval foramen, the foramen ovale, for the transmission of the third division of the fifth, the small meningeal artery, and the small petrosal nerve. At the inner side of the foramen ovale, a small aperture may occasionally be seen opposite the root of the pterygoid process. It is the foramen vesali transmitting a small vein. Lastly, in the apex of the spine of the sphenoid is a short canal sometimes double the foramen spinosum. It transmits the middle meningeal artery. The external surface is convex and divided by a transverse ridge, the pterygoid ridge, into two portions. The superior are larger, convex from above downwards, concave from before backwards, enters into the formation of the temporal fossa and attaches part of the temporal muscle. The inferior portion, smaller in size and concave, enters into the formation of the zygomatic fossa and affords attachment to the external pterygoid muscle. It presents at its posterior part a sharp pointed eminence of bone, the spinous process, to which is connected the internal lateral ligament of the lower jaw and the laxator tympani muscle. The pterygoid ridge dividing the temporal and zygomatic portions gives attachment to the upper origin of the external pterygoid muscle. At its inner extremity is a long triangular spine of bone which serves to increase the extent of origin of this muscle. The anterior or orbital surface, smooth and quadrilateral in form, assists in forming the outer wall of the orbit. It is bounded above by a serrated edge for articulation with the frontal bone, below by a rounded border which enters into the formation of the sphenomaxillary fissure. Internally, it enters into the formation of the sphenoidal fissure, whilst externally it presents a serrated margin for articulation with the malar bone. At the upper part of the inner border is a notch for the transmission of a branch of the ophthalmic artery, and at its lower part a small pointed spine of bone which serves for the attachment of part of the lower head of the external rectus. One or two small foramina may occasionally be seen for the passage of arteries. They are called the external orbitar foramina. Circumference. From the body of the sphenoid to the spine, commencing from behind, the outer half of this margin is serrated for articulation with the petrous portion of the temporal bone, whilst the inner half forms the anterior boundary of the foramen lacerum medium and presents the posterior aperture of the Vidian canal. In front of the spine, the circumference of the great wing presents a serrated edge beveled at the expense of the inner table below and of the external above, which articulates with the squamous portion of the temporal bone. At the tip of the great wing, a triangular portion is seen, beveled at the expense of the internal surface for articulation with the anterior-inferior angle of the parietal bone. Internal to this is a broad serrated edge for articulation with the frontal bone. This surface is continuous internally with the sharp inner edge of the orbital plate, which assists in the formation of the sphenoidal fissure. The lesser wings or processes of ingratias are two thin triangular plates of bone which arise from the upper and anterior part of the body of the sphenoid and, projecting transversely outwards, terminate in a more or less acute point. The superior surface of each is smooth, flat, broader internally than externally, and supports the anterior lobe of the brain. The inferior surface forms the back part of the roof of the orbit and the upper boundary of the sphenoidal fissure or foramen lacerum anterius. This fissure is of a triangular form and leads from the cavity of the cranium into the orbit. It is bounded internally by the body of the sphenoid, above by the lesser wing, and below by the orbital surface of the great wing, and is converted into a foramen by the articulation of this bone with the frontal. It transmits the third, fourth ophthalmic division of the fifth and sixth nerves and the ophthalmic vein. The anterior border of the lesser wing is serrated for articulation with the frontal bone. The posterior, smooth and rounded, is received into the fissure of sylvius of the brain. The inner extremity of this border forms the anterior clinoid process. The lesser wing is connected to the side of the body by two roots, the upper thin and flat, the lower thicker, obliquely directed, and presenting on its outer side a small tubercle for the attachment of the common tendon of the muscles of the eye. Between the two roots is the optic foramen for the transmission of the optic nerve and ophthalmic artery. The pterygoid process shown in figure 31, one on each side, descend perpendicularly from the point where the body and great wing unite. Each process consists of an external and an internal plate separated behind by an intervening notch but joined partially in front. The external pterygoid plate is broad and thin, turned a little outwards, and forms part of the inner wall of the zygomatic fossa. It gives attachment by its outer surface to the external pterygoid. Its inner surface forms part of the pterygoid fossa and gives attachment to the internal pterygoid. The internal pterygoid plate is much narrower and longer, curving outwards at its extremity into a hook-like process of bone, the hamular process, around which turns the tendon of the tensor palatii muscle. At the base of this plate is a small, oval, shallow depression, the scaphoid fossa, from which arises the tensor palatii, and above which is seen the posterior orifice of the Ovidian canal. The outer surface of this plate forms part of the pterygoid fossa, the inner surface forming the outer boundary of the posterior aperture of the nares. The two pterygoid plates are separated below by an angular notch in which the pterygoid process or tuberosity of the palate bone is received. The anterior surface of the pterygoid process is very broad at its base and supports Meckel's ganglion. It presents above the anterior orifice of the Ovidian canal and below a rough margin which articulates with the perpendicular plate of the palate bone. Development. The sphenoid bone is developed by 10 centers, 6 for the posterior sphenoidal division and 4 for the anterior sphenoid. The 6 centers for the post sphenoid are 1 for each greater wing and external pterygoid plate, 1 for each internal pterygoid plate, 2 for the posterior part of the body. The 4 for the anterior sphenoid are 1 for each lesser wing and anterior part of the body, and 1 for each sphenoidal turbinated bone. Ossification takes place in these pieces in the following order. The greater wing and external pterygoid plate are first formed, ossific granules being deposited close to the foramen rotundum on each side at about the second month of fetal life. Ossification spreading outwards into the great wing and downwards into the external pterygoid process. Each internal pterygoid plate is then formed and becomes united to the external about the middle of fetal life. The two centers for the posterior part of the body appear as separate nuclei, side by side, beneath the sella turcica. They join about the middle of fetal life into a single piece which remains ununited to the rest of the bone until after birth. Each lesser wing is formed by a separate center which appears on the outer side of the optic foramen at about the third month. They become united and join with the body at about the 8th month of fetal life. At about the end of the third year, ossification has made its appearance in the sphenoidal spongy bones. At birth, the sphenoid consists of 3 pieces, with the greater wing and pterygoid processes on each side, the lesser wings and body united. At the first year after birth, the greater wings and body are united. From the 10th to the 12th year, the spongy bones commence their junction to the sphenoid and become completely united by the 20th year. Lastly, the sphenoid joins the occipital. Articulations. The sphenoid articulates with all the bones of the cranium and 5 of the face, the 2 malar, 2 palate and vomer. The exact extent of articulation with each bone is shown in the accompanying figures. Attachment of muscles. The temporal external pterygoid, internal pterygoid, superior constrictor, tensor palatii, laxator tympani, levator palpebrae, obliquus superior, superior rectus, internal rectus, inferior rectus, external rectus. For the exact attachment of the muscles of the eye to the sphenoid bone, see figure 113.3. The sphenoidal spongy bones. The sphenoidal spongy bones are two thin, curved plates of bone which exist as separate pieces up to the 15th year. They are situated at the anterior and inferior part of the body of the sphenoid, serving to close in the sphenoidal sinuses in this situation. They are irregular in form, thick and tapering to a point behind, broader and thinner in front. Their inner surface, which looks towards the cavity of the sinus, is concave. Their outer surface convex. Each bone articulates in front with the ethmoid, an aperture of variable size being left in their anterior wall, which communicates with the posterior ethmoidal cells. Behind, its point is placed under the vomer and is received between the root of the pterygoid process on the outer side and the rostrum of the sphenoid on the inner. Externally, it articulates with the palate. The ethmoid. The ethmoid, anthmos in Greek, a sieve, is an exceedingly light, spongy bone of a cubical form situated at the anterior part of the base of the cranium between the two orbits at the root of the nose. It consists of three parts: a horizontal plate, which forms part of the base of the cranium, a perpendicular plate, which forms part of the septum nasi, and two lateral masses of cells. The horizontal or cribriform plate, as shown in figure 33, forms part of the anterior fossa of the base of the skull and is received into the ethmoid notch of the frontal bone between the two orbital plates. Projecting upwards from the middle line of this plate at its forepart is a thick, smooth, triangular process of bone, the crista galli, so called from its resemblance to a cock's comb. Its base joins the cribriform plate. Its posterior border, long, thin, and slightly curved, serves for the attachment of the falx cerebri. Its anterior, short and thick, articulates with the frontal bone and presents at its lower part two small projecting alae, which are received into corresponding depressions in the frontal, completing the foramen cecum behind. Its sides are smooth and sometimes bulging when it is found to enclose a small sinus. On each side of the crista galli, the cribriform plate is concave to support the bulb of the olfactory nerves and perforated by numerous foramina for the passage of its filaments. These foramina consist of three sets corresponding to the three sets of olfactory nerves. An inner, which are lost in grooves on the upper part of the septum, an outer set continued onto the surface of the upper spongy bones, whilst the middle set runs simply through the bone and transmit nerves distributed to the roof of the nose. At the front part of the cribriform plate, by the side of the crista galli, is a small fissure which transmits the nasal branch of the ophthalmic nerve, and at its posterior part a triangular notch which receives the ethmoidal spine of the sphenoid. The perpendicular plate is a thin central lamella of bone which descends from the undersurface of the cribriform plate and assists in forming the septum of the nose. Its anterior border articulates with the frontal spine and crest of the nasal bones. Its posterior, divided into two parts, is connected by its upper half with the rostrum of the sphenoid, its lower half with the vomer. The inferior border serves for the attachment of the triangular cartilage of the nose. On each side of the perpendicular plate, numerous grooves and canals are seen leading from the foramina on the cribriform plate. They lodge the filaments of the olfactory nerves. The lateral masses of the ethmoid are made up of a number of thin-walled cellular cavities called the ethmoidal cells. In the disarticulated bone, many of these appear to be broken, but when the bones are articulated, they are closed in every part. The superior surface of each lateral mass presents a number of these apparently half-broken cellular spaces. These, however, are completely closed in when articulated with the edges of the ethmoidal fissure of the frontal bone. Crossing this surface are seen two grooves on each side converted into canals by articulation with the frontal. They are the anterior and posterior ethmoidal foramina. They open on the inner wall of the orbit and transmit the anterior ethmoidal vessels and nasal nerve. The posterior ethmoidal artery and vein. The posterior surface also presents large irregular cellular cavities which are closed in by articulation with the sphenoidal turbinated bones and orbital process of the palate. The cells at the anterior surface are completed by the lacrimal bone and nasal process of the superior maxillary, and those below also by the superior maxillary. On the outer surface of each lateral mass is a thin, smooth, square plate of bone called the os planum. It forms part of the inner wall of the orbit and articulates above with the frontal, below with the superior maxillary and orbital process of the palate, in front with the lacrimal, and behind with the sphenoid. The cellular cavities of each lateral mass, thus walled in by the os planum on the outer side and by its articulation with the other bones already mentioned, are divided by a thin transverse bony partition into two sets which do not communicate with each other. They are termed the anterior and posterior ethmoidal cells. The former, the most numerous, communicate with the frontal sinuses above and the middle meatus below by means of a long flexuous cellular canal, the infundibulum. The posterior, the smallest and least numerous, open into the superior meatus and communicate occasionally with the sphenoidal sinuses behind. If the inner wall of each lateral mass is now examined, it will be seen how these cellular cavities communicate with the nose. The internal surface of each lateral mass presents at its upper and back part a narrow horizontal fissure, the superior meatus of the nose, bounded above by a thin curved plate of bone, the superior turbinated bone of the ethmoid. By means of an orifice at the top part of this fissure, the posterior ethmoidal cells open into the nose. Below the superior meatus is seen the convex surface of another thin convoluted plate of bone, the middle turbinated bone. It extends along the whole length of the inner wall of each lateral mass. Its lower margin is free and thick, and its concavity directed outwards assists in forming the middle meatus. It is by means of a large orifice at the upper and front part of this fissure that the anterior ethmoid cells, and through them the frontal sinuses by means of a funnel-shaped canal, the infundibulum, communicate with the nose. It will be remarked that the whole of this surface is rough and marked with numerous grooves and orifices which run nearly vertically downwards from the cribriform plate. They lodge the branches of the olfactory nerve which are distributed on the mucous membrane covering this surface. From the inferior part of each lateral mass, immediately beneath the os planum, there projects downwards and backwards an irregular lamina of bone called the unciform process from its hook-like form. It serves to close in the upper part of the orifice of the antrum and articulates with the inferior turbinated bone. Development by three centers, one for the perpendicular lamella and one for each lateral mass. The lateral masses are first developed ossific granules making their first appearance in the os planum between the fourth and fifth months of fetal life and afterwards in the spongy bones. At birth, the bone consists of the two lateral masses, which are small and ill developed, but when the perpendicular and horizontal plates begin to ossify, as they do about the first year after birth, the lateral masses become joined to the cribriform plate. The formation and increase in the ethmoidal cells, which complete the formation of the bone, take place about the fifth or sixth year. Articulation with 15 bones, the sphenoid, 2 sphenoidal turbinated, the frontal, and 11 of the face, 2 nasal, 2 superior maxillary, 2 lacrimal, 2 palate, 2 inferior turbinated, and vomer. The Wormian bones. The Wormian bones, called also from their generally triangular form, ossa triquetra, are irregular plates of bone presenting much variation in situation, number, and size. They are most commonly found in the course of the sutures, especially the lambdoid and sagittal, where they occasionally exist of large size. The superior angle of the occipital and the anterior superior angle of the parietal being occasionally replaced by large Wormian bones. They are not limited to the vertex, for they are occasionally found at the side of the skull in the situation of the anterior inferior angle of the parietal bone and in the squamous suture. And more rarely, they have been found at the base in the suture between the sphenoid and ethmoid bones. Their size varies, in some cases not being larger than a pin's head and confined entirely to the outer table. In other cases, so large that a pair of these bones formed the whole of that portion of the occipital bone above the superior curved lines as described by Becklard and others. Their number is most generally limited to 2 or 3, but more than 100 have been found in the skull of an adult hydrocephalic skeleton. It appears most probable that they are separate accidental points of ossification which during their development and growth remain separate from the adjoining bones. In their development, structure, and mode of articulation, they resemble the other cranial bones. Bones of the face. The facial bones are 14 in number, with the 2 nasal, 2 superior maxillary, 2 lacrimal, 2 malar, 2 palate, 2 inferior turbinated, vomer, and the inferior maxillary. Nasal bones. The nasal bones shown in figures 35 and 36 are 2 small oblong bones varying in size and form. Nasal bones. The nasal bones are shown in figures 35, 36. Sorry. The nasal bones as shown in figures 35, 36 are 2 small oblong bones varying in size and form in different individuals. They are placed side by side at the middle and upper part of the face, forming by their junction the bridge of the nose. Each bone presents for examination 2 surfaces and 4 borders. The outer surface is concave from above downwards, convex from side to side. It is covered by the compressor nasi muscle, marked by numerous small arterial furrows, and perforated about its center by a foramen, sometimes double, for the transmission of a small vein. Sometimes this foramen is absent on one or both sides, and occasionally the foramen cecum opens on this surface. The inner surface is concave from side to side, convex from above downwards, in which direction it is traversed by a well-marked longitudinal groove, sometimes a canal, for the passage of a branch of the nasal nerve. The superior border is narrow, thick, and serrated for articulation with the nasal notch of the frontal bone. The inferior border is broad, thin, sharp, directed obliquely downwards, outwards, and backwards, serving for the attachment of the lateral cartilage of the nose. This border presents about its center a notch which transmits the branch of the nasal nerve referred to above and is prolonged at its inner extremity into a sharp spine which when articulated with the opposite bone forms the nasal angle. The external border is serrated, beveled at the expense of the internal surface above and of the external below to articulate with the nasal process of the superior maxillary. The internal border, thicker above than below, articulates with its fellow of the opposite side and is prolonged behind into a vertical crest which forms part of the development of the nose. This crest articulates with the nasal spine of the frontal above and the perpendicular plate of the ethmoid below. Development by one center for each bone, which appears about the same period as in the vertebrae. Articulations. With 4 bones, 2 of the cranium, the frontal and ethmoid, and 2 of the face, the opposite nasal and the superior maxillary. No muscles are directly attached to this bone. Superior maxillary bone. The superior maxillary is one of the most important bones of the face in a surgical point of view on account of the number of diseases to which some of its parts are liable. Its minute examination becomes therefore a matter of considerable importance. It is the largest bone of the face excepting the lower jaw and forms by its union with its fellow of the opposite side the whole of the upper jaw. Each bone assists in the formation of 3 cavities: the roof of the mouth, the floor and outer wall of the nose, and the floor of the orbit. Enters into the formation of 2 fossae, the zygomatic and sphenomaxillary, and 2 fissures, the sphenomaxillary and pterygomaxillary. Each bone presents for examination a body and 4 processes: malar, nasal, alveolar, and palatine. The body is somewhat quadrilateral and is hollowed out in its interior to form a large cavity, the antrum of Highmore. It presents for examination 4 surfaces: an external or facial, a posterior or zygomatic, a superior or orbital, and an internal. The external or facial surface, shown in figure 37, is directed forwards and outwards. In the median line of the bone, just above the incisor teeth, is a depression, the incisive or myrtiform fossa, which gives origin to the depressor labii superioris alaceae nasi. Above and a little external to it, the compressor naris arises. More external and immediately beneath the orbit is another depression, the canine fossa, larger and deeper than the incisive fossa, from which it is separated by a vertical ridge, the canine eminence, corresponding to the socket of the canine tooth. The canine fossa gives origin to the levator anguli oris. Above the canine fossa is the infraorbital foramen, the termination of the infraorbital canal. It transmits the infraorbital nerve and artery. Above the infraorbital foramen is the margin of the orbit, which affords partial attachment to the levator labii superioris proprius muscle. The posterior or zygomatic surface is convex, directed backwards and outwards, and forms part of the zygomatic fossa. It presents about its center 2 or 3 grooves leading to canals in the substance of the bone. They are termed the posterior dental canals and transmit the posterior dental vessels and nerves. At the lower part of this surface is a rounded eminence, the maxillary tuberosity, especially prominent after the growth of the wisdom tooth, rough on its inner side for articulation with the tuberosity of the palate bone. At the upper and inner part of this surface is the commencement of a groove which, running down on the nasal surface of the bone, is converted into a canal by articulation with the palate bone, forming the posterior palatine canal. The superior or orbital surface is thin, smooth, irregularly quadrilateral, and forms part of the floor of the orbit. It is bounded internally by an irregular margin which articulates with three bones. In front with the lacrimal, in the middle with the os planum of the ethmoid, and behind with the orbital process of the palate bone. Posteriorly by a smooth rounded edge which enters into the formation of the sphenomaxillary fissure and which sometimes articulates at its anterior extremity with the orbital plane of the sphenoid. Bounded externally by the malar process and in front by part of the circumference of the orbit continuous on the inner side with the nasal, on the outer side with the malar process. Along the middle line of this surface is a deep groove, the infraorbital, for the passage of the infraorbital nerve and artery. This groove commences at the middle of the posterior border of the bone and passing forwards terminates in a canal which subdivides into two branches. One of the canals, the infraorbital, opens just below the margin of the orbit. The other, the smaller and most posterior one, runs in the substance of the anterior wall of the antrum. It is called the anterior dental, transmitting the anterior dental vessels and nerves to the front teeth of the upper jaw. The internal surface, shown in figure 38, is unequally divided into two parts by a horizontal projection of bone, the palatine process. That portion above the palate process forms part of the outer wall of the nose. The portion below it forms part of the cavity of the mouth. The superior division of this surface presents a large irregular shaped opening leading into the antrum of Highmore. At the upper border of this aperture are a number of broken cellular cavities which in the articulated skull are closed in by the ethmoid and lacrimal bones. Below the aperture is a smooth concavity which forms part of the inferior meatus of the nose, traversed by a fissure, the maxillary fissure, which runs from the lower part of the orifice of the antrum obliquely downwards and forwards and receives the maxillary process of the palate. Behind it is a rough surface which articulates with the perpendicular plate of the palate bone, traversed by a groove which, commencing near the middle of the posterior border, runs obliquely downwards and forwards and forms, when completed by its articulation with the palate bone, the posterior palatine canal. In front of the opening in the antrum is a deep groove converted into a canal by the lacrimal and inferior turbinated bones, enlarging the nasal duct. More anteriorly is a well-marked rough ridge, the inferior turbinated crest for articulation with the inferior turbinated bone. The concavity above this ridge forms part of the middle meatus of the nose, whilst that below it forms part of the inferior meatus. The inferior division of this surface is concave, rough and uneven, and perforated by numerous small foramina for the passage of nutrient vessels. The antrum of Highmore or maxillary sinus is a large triangular shaped cavity hollowed out of the body of the maxillary bone. Its apex, directed outwards, is formed by the malar process, its base by the outer wall of the nose. Its walls are everywhere exceedingly thin, its roof being formed by the orbital plate, its floor by the alveolar process, bounded in front by the facial surface, and behind by the zygomatic. Its inner wall or base presents in the disarticulated bone a large irregular aperture which communicates with the nasal fossae. The margins of this aperture are thin and ragged, and the aperture itself is much contracted by its articulation with the ethmoid above, the inferior turbinated below, and the palate bone behind. In the articulated skull, this cavity communicates with the middle meatus of the nose, generally by two small apertures left between the above mentioned bones. In the recent state, usually only one small opening exists near the upper part of the cavity, sufficiently large to admit the end of a probe, the rest being filled in by the lining membrane of the sinus. Crossing the cavity of the antrum are often seen several projecting laminae of bone, similar to those seen in the sinuses of the cranium, and on its outer wall are the posterior dental canals, transmitting the posterior dental vessels and nerves to the teeth. Projecting into the floor are several conical processes corresponding to the roots of the first and second molar teeth. In some cases, the floor is even perforated by the teeth in this situation. It is from the extreme thinness of the walls of this cavity that we are enabled to explain how tumors growing from the antrum encroach upon the adjacent parts, pushing up the floor of the orbit and displacing the eyeball, projecting inward into the nose, protruding forwards onto the cheek, and making their way backwards into the zygomatic fossa and downwards into the mouth. The malar process is a rough, triangular eminence situated at the angle of separation of the facial from the zygomatic surface. In front, it is concave, forming part of the facial surface. Behind, it is also concave and forms part of the zygomatic fossa. Superiorly, it is rough and serrated for articulation with the malar bone, whilst below, a prominent ridge marks the division between the facial and zygomatic surfaces. The nasal process is a thick triangular plate of bone which projects upwards, inwards, and backwards by the side of the nose, forming its lateral boundary. Its external surface is concave, smooth, perforated by numerous foramina, and gives attachment to the levator labii superioris aliqui and nasi, the orbicularis palpebrarum, and tendo oculi. Its internal surface forms part of the inner wall of the nares. It articulates above with the frontal and presents a rough, uneven surface which articulates with the ethmoid bone, closing in the anterior ethmoid cells. Below this is a transverse ridge, the superior turbinated crest for articulation with the middle turbinated bone of the ethmoid, bounded below by a smooth concavity which forms part of the middle meatus. Below this is the inferior turbinated crest already described for articulation with the inferior turbinated bone, and still more inferiorly the concavity which forms part of the inferior meatus. The anterior border of the nasal process is thin and serrated for articulation with the nasal bone. Its posterior border thick and hollowed into a groove for the nasal duct. Of the two margins of this groove, the inner one articulates with the lacrimal bone, the outer one forming part of the circumference of the orbit. Just where this border joins the orbital surface is a small tubercle, the lacrimal tubercle. This serves as a guide to the surgeon in the performance of the operation for fistula lacrimalis. The lacrimal groove in the articulated skull is converted into a canal by the lacrimal bone and lacrimal process of the inferior turbinated. It is directed downwards and a little backwards and outwards, is about the diameter of a goose quill, slightly narrower in the middle than at either extremity, and largest than nasal duct. The alveolar process goodness. The alveolar process is the thickest part of the bone, broader behind than in front, and excavated into deep cavities for the reception of the teeth. These cavities are 8 in number and vary in size and depth according to the teeth they contain. Those for the canine teeth being the deepest, those for the molars being the widest, and subdivided into minor cavities. Those for the incisors being single but deep and narrow. The palate process, thick and strong, projects horizontally inwards from the inner surface of the bone. It is much thicker in front than behind and forms the floor of the nares and the roof of the mouth. Its upper surface is concave from side to side, smooth, and forms part of the floor of the nose. In front is seen the upper orifice of the anterior palatine incisor canal, which leads into a fossa formed by the junction of the two superior maxillary bones and situated immediately behind the incisor teeth. It transmits the anterior palatine vessels, the nasopalatine nerves passing through the intermaxillary suture. The inferior surface, also concave, is rough and uneven and forms part of the roof of the mouth. This surface is perforated by numerous foramina for the passage of nutritious vessels channeled at the back part of its alveolar border by a longitudinal groove, sometimes a canal, for the transmission of the posterior palatine vessels, and a large nerve, and presents little depressions for the lodgement of the palatine glands. This surface presents anteriorly the lower orifice of the anterior palatine fossa. The outer border is firmly united with the rest of the bone. The inner border is thicker in front than behind, raised above into a ridge, which, with the corresponding ridge in the opposite bone, forms a groove for the reception of the vomer. The anterior margin is bounded by the thin concave border of the opening of the nose, prolonged forwards internally into a sharp process, forming, with a similar process of the opposite bone, the anterior nasal spine. The posterior border is serrated for articulation with the horizontal plate of the palate bone. Development shown in figure 39. This bone is formed at such an early period, and ossification proceeds in it with such rapidity that it has been found impracticable hitherto to determine with accuracy its number of centers. It appears, however, probable that it has 4 centers of development, viz. One for the nasal and facial portions, one for the orbital and malar, one for the incisive, and one for the palatal portion, including the entire palate except the incisive segment. The incisive portion is indicated in young bones by a fissure, which marks off a small segment of the palate, including the 2 incisor teeth. In some animals, this remains permanently as a separate piece, constituting the intermaxillary bone. And in the human subject, where the jaw is malformed, a detached piece is often found in this situation, most probably depending upon arrest of development of this center. The maxillary sinus appears at an earlier period than any of the other sinuses, its development commencing about the 4th month of fetal life. Articulations with 9 bones, 2 of the cranium, the frontal and ethmoid, and with 7 of the face, with the nasal, malar, lacrimal, inferior turbinated, palate, vomer, and its fellow of the opposite side. Sometimes it articulates with the orbital plate of the sphenoid. Attachment of muscles. Orbicularis palpebrarum, obliquus inferior oculi, levator labii superioris alacae nasi, levator labii superioris proprius, levator angulioris, compressor naris, depressor alae nasi, masseter buccinator. The lacrimal bones. The lacrimal are the smallest and most fragile of all the bones of the face, situated at the front part of the inner wall of the orbit and resemble somewhat in form, thinness, and size a fingernail. Hence, they are termed the ossa unguis. Each bone represents, for examination, two surfaces and four borders. The external, as shown in figure 40, the external or orbital surface is divided by a vertical ridge into two parts. The portion of bone in front of this ridge presents a smooth, concave, longitudinal groove, the free margin of which unites with the nasal process of the superior maxillary bone, completing the lacrimal groove. The upper part of this groove lodges the lacrimal sac. The lower part is continuous with the lacrimal canal and lodges the nasal duct. The portion of bone behind the ridge is smooth, slightly concave, and forms part of the inner wall of the orbit. The ridge and part of the orbital surface immediately behind it affords attachment to the tensor tarsi. It terminates below in a small hook-like process which articulates with the lacrimal tubercle of the superior maxillary bone and completes the upper orifice of the lacrimal canal. It sometimes exists as a separate piece, which is then called the lesser lacrimal bone. The internal or nasal surface presents a depressed furrow corresponding to the elevated ridge on its outer surface. The surface of bone in front of this forms part of the middle meatus, and that behind it articulates with the ethmoid bone, filling in the anterior ethmoidal cells. Of the four borders, the anterior is the longest and articulates with the nasal process of the superior maxillary bone. The posterior, thin and uneven, articulates with the os planum of the ethmoid. The superior border, the shortest and thickest, articulates with the internal angular process of the frontal bone. The inferior is divided The inferior is divided by the lower edge of the vertical crest into two parts, the posterior articulating with the orbital plate of the superior maxillary bone, the anterior portion being prolonged downwards into a pointed process which articulates with the lacrimal process of the inferior turbinate bone, assisting in the formation of the lacrimal canal. Development by a single center, which makes its appearance soon after ossification of the vertebrae has commenced. Articulations with four bones, two of the cranium, the frontal and ethmoid, and two of the face, the superior maxillary and the inferior turbinated. Attachment of muscles, the tensor tarsi. The malar bones. The malar are two small quadrangular bones situated at the upper and outer part of the face, forming the prominence of the cheek, part of the outer wall and floor of the orbit, and part of the temporal and zygomatic fossae. Each bone presents for examination an external and an internal surface, four processes, the frontal, orbital, maxillary, and zygomatic, and four borders. The external surface, as shown in figure 41, is smooth, convex, perforated near its center by one or two small apertures, the malar canals for the passage of small nerves and vessels, covered by the orbicularis palpebrum muscle, and affords attachment to the zygomaticus major and minor muscles. The internal surface, shown in figure 42, directed backwards and inwards, is concave, presenting internally a rough triangular surface for articulation with the superior maxillary bone, and externally a smooth concave surface which forms the anterior boundary of the temporal fossa above, wider below, where it forms part of the zygomatic fossa. This surface presents a little above its center the aperture of one or two malar canals and affords attachment to part of two muscles, the temporal above and the masseter below. Of the four processes, the frontal is thick and serrated and articulates with the external angular process of the frontal bone. The orbital process is a thick and strong plate which projects backwards from the orbital margin of the bone. Its upper surface, smooth and concave, forms by its junction with the great ala of the sphenoid, the outer wall of the orbit. Its undersurface, smooth and convex, forms part of the temporal fossa. Its anterior margin is smooth and rounded, forming part of the circumference of the orbit. Its superior margin, rough and directed horizontally, articulates with the frontal behind the external angular process. Its posterior margin is rough and serrated for articulation with the sphenoid. Internally, it is also serrated for articulation with the orbital process of the superior maxillary. At the angle of junction of the sphenoid and maxillary portions, a sharp, rounded, non-articular margin is sometimes seen. This forms the anterior boundary of the spheno-maxillary fissure. Occasionally, no such non-articular surface exists, the fissure being completed by the direct junction of the maxillary and sphenoid bones, or by the interposition of a small Wormian bone in the angular interval between them. On the upper surface of the orbital process are seen the orifices of one or two malar canals. One of these usually opens on the posterior surface, the other, occasionally two, on the facial surface. They transmit filaments of the orbital branch of the superior maxillary nerve. The maxillary process is a rough triangular surface which articulates with the superior maxillary bone. The zygomatic process, long, narrow and serrated, articulates with the zygomatic process of the temporal bone. Of the four borders, the superior or orbital is smooth, arched, and forms a considerable part of the circumference of the orbit. The inferior or zygomatic is continuous with the lower border of the zygomatic arch, affording attachment by its rough edge to the masseter muscle. The anterior or maxillary border is rough and beveled at the expense of its inner table to articulate with the superior maxillary bone, affording attachment by its outer margin to the levator labii superioris proprius, just at its point of junction with the superior maxillary. The posterior or temporal border, curved like an italic S, is continuous above with the commencement of the temporal ridge, below with the upper border of the zygomatic arch. It affords attachment to the temporal fascia. Development. Development by a single center of ossification which appears at about the same period when ossification of the vertebrae commences. Articulations with four bones, three of the cranium, frontal, sphenoid and temporal, and one of the face, the superior maxillary. Attachment of muscles. Levator labii superioris proprius, zygomaticus major and minor, masseter and temporal. The palate bones. The palate bones are situated at the posterior part of the nasal fossae, wedged in between the superior maxillary and the pterygoid process of the sphenoid. In form, they are somewhat like the letter L. Each bone assists in the formation of three cavities: the floor and outer wall of the nose, the roof of the mouth, and the floor of the orbit, and enters into the formation of three fossae: the zygomatic, sphenomaxillary, and pterygoid. Each bone consists of two portions: an inferior or horizontal plate, a superior or vertical plate. Horizontal plate is thick, of a quadrilateral form, and presents two surfaces and four borders. The superior surface, concave from side to side, forms the back part of the floor of the nares. The inferior surface, slightly concave and rough, forms the back part of the hard palate. At its posterior part may be seen a transverse ridge, more or less marked, for the attachment of the tendon of the tensor palati muscle. At the outer extremity of this ridge is a deep groove converted into a canal by its articulation with the tuberosity of the superior maxillary bone and forming the posterior palatine canal. Near this groove, the orifices of one or two small canals, accessory posterior palatine, may frequently be seen. The anterior border is serrated, beveled at the expense of its inferior surface, and articulates with the palate process of the superior maxillary bone. The posterior border is concave, free, and serves for the attachment of the soft palate. Its inner extremity is sharp and pointed, and when united with the opposite bone, forms a projecting process, the posterior nasal spine, for the attachment of the azygos ovale. The external border is united with the lower part of the perpendicular plate almost at right angles. The internal border, the thickest, is serrated for articulation with its fellow of the opposite side. Its superior edge is raised into a ridge which, united with the opposite bone, forms a groove in which the vomer is received. The vertical plate, shown in figure 43, is thin, of an oblong form and directed upwards and a little inwards. It presents two surfaces, an external and an internal, and four borders. The internal surface presents at its lower part a broad shallow depression which forms part of the lateral boundary of the inferior meatus. Immediately above this is a well-marked horizontal ridge, the inferior turbinated crest, for the articulation of the inferior turbinated bone. Above this, a second broad shallow depression may be seen, which forms part of the lateral boundary of the middle meatus, surmounted above by a horizontal ridge, less prominent than the inferior, the superior turbinated crest, for the articulation of the middle turbinated bone. Above the superior turbinated crest is a narrow horizontal groove which forms part of the superior meatus. The external surface is rough and irregular throughout the greater part of its extent for articulation with the inner surface of the superior maxillary bone, its upper and back part being smooth where it enters into the formation of the zygomatic fossa. It is also smooth in front where it covers the orifice of the antrum. This surface presents towards its back part a deep groove converted into a canal, the posterior palatine, by its articulation with the superior maxillary bone. It transmits the posterior palatine vessels and a large nerve. The anterior border is thin, irregular, and presents opposite the inferior turbinated crest a pointed projecting lamina, the maxillary process of the palate bone, which is directed forwards and closes in the lower and back part of the opening of the antrum, being received into a fissure that exists at the inferior part of this aperture. The posterior border, as shown in figure 44, presents a deep groove, the edges of which are serrated for articulation with the pterygoid process of the sphenoid. At the lower part of this border is seen a pyramidal process of bone, the pterygoid process or tuberosity of the palate, which is received into the angular interval between the two pterygoid plates of the sphenoid at their inferior extremity. This process presents at its back part three grooves, a median and two lateral ones. The former is smooth and forms part of the pterygoid fossa, affording attachment to the internal pterygoid muscle, whilst the lateral grooves are rough and uneven for articulation with the anterior border of each pterygoid plate. The base of this process, continuous with the horizontal portion of the bone, presents the apertures of the accessory descending palatine canals, whilst its outer surface is rough for articulation with the inner surface of the body of the superior maxillary bone. The superior border of the vertical plate, the superior border of the vertical plate presents two well-marked processes separated by an intervening notch or foramen. The anterior or larger is called the orbital process, the posterior the sphenoidal. The orbital process, directed upwards and outwards, is placed on a higher level than the sphenoidal. It presents five surfaces which enclose a hollow cellular cavity and is connected to the perpendicular plate by a narrow constricted neck. Of these five surfaces, three are articular, two non-articular or free surfaces. The three articular are the anterior or maxillary surface, which is directed forwards, outwards, and downwards, is of an oblong form and rough for articulation with the superior maxillary bone. The posterior or sphenoidal surface is directed backwards, upwards, and inwards. It ordinarily presents a small half cellular cavity which communicates with the sphenoidal sinus and the margins of which are serrated for articulation with the vertical part of the sphenoidal turbinated bone. The internal or ethmoidal surface is directed inwards, upwards, and forwards and articulates with the lateral mass of the ethmoid bone. In some cases, the cellular cavity above mentioned opens on this surface of the bone. It then communicates with the posterior ethmoidal cells. More rarely, it opens on both surfaces and then communicates with the posterior ethmoidal cells and the sphenoidal sinus. The non-articular or free surfaces of the orbital process are the superior or orbital, directed upwards and outwards, of a triangular form, concave, smooth, articulating with the superior maxillary bone and forming the back part of the floor of the orbit. The external or zygomatic surface, directed outwards, backwards, and downwards, is of an oblong form, smooth, and forms part of the zygomatic fossa. This surface is separated from the orbital by a smooth rounded border which enters into the formation of the sphenomaxillary fissure. The sphenoidal process of the palate bone is a thin compressed plate much smaller than the orbital and directed upwards and inwards. It presents three surfaces and two borders. The superior surface, the smallest of the three, articulates with the horizontal part of the sphenoidal turbinated bone. It presents a groove which contributes to the formation of the pterygopalatine canal. The internal surface is concave and forms part of the outer wall of the nasal fossa. The external surface is divided into two parts, an articular and a non-articular portion. The non-articular portion is smooth and free, forming part of the zygomatic fossa, whilst behind is a rough surface for articulation with the inner surface of the pterygoid process of the sphenoid. The anterior border forms the posterior boundary of the sphenopalatine foramen. The posterior border, serrated at the expense of the outer table, articulates with the internal surface of the pterygoid process. The orbital and sphenoidal processes are separated from one another by a deep notch, which is converted into a foramen, the sphenopalatine, by articulation with the sphenoidal turbinated bone. Sometimes the two processes are united above and form between them a complete foramen, or the notch is crossed by one or more spiculae of bone so as to form two or more foramina. In the articulated skull, this foramen opens into the back part of the outer wall of the superior meatus and transmits the sphenopalatine vessels and nerves. Development. From a single center which makes its appearance at the angle of junction of the two plates of the bone. From this point, ossification spreads inwards to the horizontal plate, downwards into the tuberosity, and upwards into the vertical plate. In the fetus, the horizontal plate is much longer than the vertical, and even after it is fully ossified, the whole bone is remarkable for its shortness. Articulations. With 7 bones, the sphenoid, ethmoid, superior maxillary, inferior turbinated, vomer, opposite palate, and sphenoidal turbinated. Attachment of muscles. The tensor palati, azygos ovule, internal and external pterygoid. The inferior turbinated bones. The inferior turbinated bones are situated one on each side of the outer wall of the nasal fossae. Each bone consists of a layer of thin spongy bone curled upon itself like a scroll, hence its name turbinated, and extending horizontally across the outer wall of the nasal fossa immediately below the orifice of the antrum. Each bone presents two surfaces, two borders, and two extremities. The internal surface is shown in figure 45. The internal surface is convex, perforated by numerous apertures, and traversed by longitudinal grooves and canals for the lodgement of arteries and veins. In the recent state, it is covered by the lining membrane of the nose. The external surface is concave, as shown in figure 46, and forms part of the inferior meatus. Its upper border is thin, irregular, and connected to various bones along the outer wall of the nose. It may be divided into three portions. Of these, the anterior articulates with the inferior turbinated crest of the superior maxillary bone, the posterior with the inferior turbinated crest of the palate bone. The middle portion of the superior border presents three well-marked processes which vary much in their size and form. Of these, the anterior and smallest is situated at the junction of the anterior fourth with the posterior three-fourths of the bone. It is small and pointed and is called the lacrimal process, for it articulates with the anterior inferior angle of the lacrimal bone and by its margins with the groove on the back of the nasal process of the superior maxillary, and thus assists in forming the lacrimal canal. At the junction of the two middle fourths of the bone, but encroaching on the latter, a broad thin plate, the ethmoidal process, ascends to join the unciform process of the ethmoid. From the lower border of this process, a thin lamina of bone curves downwards and outwards, hooking over the lower edge of the orifice of the antrum, which it narrows below. It is called the maxillary process and fixes the bone firmly onto the outer wall of the nasal fossa. The inferior border is free, thick, and cellular in structure, more especially in the center of the bone. Both extremities are more or less narrow and pointed. If the bone is held so that its outer concave surface is directed backwards, that is towards the holder, and its superior border from which the lacrimal and ethmoidal processes project upwards, the lacrimal process will be directed to the side to which the bone belongs. Development by a single center which makes its appearance about the middle of fetal life. Articulations with four bones, one of the cranium, the ethmoid, and three of the face, the superior maxillary, lacrimal, and palate. No muscles are attached to this bone. The vomer is shown in figure 47. The vomer is a single bone situated vertically at the back part of the nasal fossae and forming part of the septum of the nose. It is thin, somewhat like a ploughshare in its form, but it varies in different individuals, being frequently bent to one or the other side. It presents for examination two surfaces and four borders. The lateral surfaces are smooth, marked with small furrows for the lodgement of blood vessels, and by a groove on each side, sometimes a canal, the nasopalatine, which runs obliquely downwards and forwards to the intermaxillary suture between the two anterior palatine canals. It transmits the nasopalatine nerve. The superior border, the thickest, presents a deep groove bounded on each side by a horizontal projecting ala of the bone. The groove receives the nostrum of the sphenoid, whilst the alae are overlapped and retained by laminae, which project from the undersurface of the body of the sphenoid at the base of the pterygoid processes. At the anterior part of the groove, a fissure is left for the transmission of blood vessels to the substance of the bone. The inferior border, the longest, is broad and uneven in front, where it articulates with the two superior maxillary bones. thin and sharp behind where it joins the palate bones. The upper half of the anterior border usually presents two laminae of bone which receive between them the perpendicular plate of the ethmoid, the lower half consisting of a single rough edge, also occasionally channeled, which is united to the triangular cartilage of the nose. The posterior border is free, concave, and separates the nasal fossae from one another behind. It is thick and bifid above, thin below. Development. The vomer at an early period consists of two lamina united below but separated above by a very considerable interval. Ossification commences in it at about the same period as in the vertebrae. Articulations. With 6 bones, 2 of the cranium, the sphenoid and ethmoid, and 4 of the face, the 2 superior maxillary, the 2 palate bones, and with the cartilage of the septum. The vomer has no muscles attached to it. The inferior maxillary bone. The inferior maxillary bone, the largest and strongest bone of the face, serves for the reception of the inferior teeth. It consists of a curved horizontal portion, the body, and of 2 perpendicular portions, the rami, which join the former nearly at right angles behind. The inferior maxillary bone is shown in figure 48. The horizontal portion or body is convex in its general outline and curved somewhat like a horseshoe. It presents for examination the 2 surfaces and 2 borders. The external surface is convex from side to side, concave from above downwards. In the median line is a well-marked vertical ridge, the symphysis. It extends from the upper to the lower border of the bone and indicates the point of junction of the 2 pieces of which the bone is composed at an early period of life. The lower part of the ridge terminates in a prominent triangular eminence, the mental process. On either side of the symphysis, just below the roots of the incisor teeth, is a depression, the incisive fossa, for the attachment of the levator mentii. And still more externally, a foramen, the mental foramen, for the passage of the mental nerve and artery. This foramen is placed just below the root of the second bicuspid tooth. Running outwards from the base of the mental process on each side is a well-marked ridge, the external oblique line. This ridge is at first nearly horizontal, but afterwards inclines upwards and backwards and is continuous with the anterior bottom of the ramus. It affords attachment to the depressor labii inferioris and depressor anguli oris below it to the platysma myoides. The internal surface is shown in figure 49. The internal surface is concave from side to side, convex from above downwards. In the middle line is an indistinct linear depression corresponding to the symphysis externally. On either side of this depression, just below its center, are 4 prominent tubercles placed in pairs, 2 above and 2 below. They are called the genial tubercles and afford attachment, the upper pair to the geniohyoglossae muscles, the lower pair to the geniohyoidae muscles. Sometimes the tubercles on each side are blended into one, or they all unite into an irregular eminence of bone, or nothing but an irregularity may be seen on the surface of the bone at this part. On either side of the genial tubercles is an oval depression, the sublingual fossa, for lodging the sublingual gland. And beneath it, a rough depression on each side, which gives attachment to the anterior belly of the digastric muscle. At the back part of the sublingual fossa, the internal oblique line, mylohyoidean, commences. It is faintly marked at its commencement but becomes more distinct as it passes upwards and outwards and is especially prominent opposite the 2 last molar teeth. It divides the lateral surface of the bone into 2 portions and affords attachment throughout its whole extent to the mylohyoid muscle, the superior constrictor being attached above its posterior extremity nearer the alveolar margin. The portion of bone above this ridge is smooth and covered by the mucous membrane of the mouth, while that below it presents an oblong depression wider behind than in front, the submaxillary fossa, for the lodgement of the submaxillary gland. The superior or alveolar border is wider and its margins thicker behind than in front. It is hollowed into numerous cavities for the reception of the teeth. These are 16 in number and vary in depth and size according to the teeth which they contain. At an early period of life, before the eruption of the teeth, the alveolar process is proportionately larger and deeper than in the adult, and the chief part of the body is above the oblique line. In adult life, the base of the bone attains its maximum of development. In old age, on the contrary, after the loss of the teeth, the alveolar process becomes absorbed, and the chief part of the body is that which exists below the oblique line. At this period, the dental canal and mental foramen are situated close to the upper border of the bone. The inferior border, longer than the superior and thicker in front than behind, is rounded. It presents a shallow groove just where the body joins the ramus over which the facial artery turns. The perpendicular portions or rami are of a quadrilateral form and differ in their direction at various periods of life. In the fetus, they are almost parallel with the body. In youth, they are oblique. In manhood, they are nearly vertical, joining the body at almost a right angle. In old age, after the loss of the teeth, they again decline and assume an oblique direction. Each ramus presents for examination two surfaces, four borders, and two processes. The external surface is flat, marked with ridges, and gives attachment throughout nearly the whole of its extent to the masseter muscle. The internal surface presents about its center the oblique aperture of the inferior dental canal for the passage of the inferior dental vessels and nerve. The margins of this opening are irregular and present in front a prominent ridge surmounted by a sharp spine which gives attachment to the internal lateral ligament of the lower jaw. And at its lower and back part is seen a notch leading to a groove which runs obliquely downwards to the posterior extremity of the submaxillary fossa. This groove is the mylohyoidean and lodges the mylohyoid vessels and nerve. Behind the groove is a rough surface for the insertion of the internal pterygoid muscle. The inferior dental canal descends obliquely downwards and forwards in the substance of the ramus and then horizontally forwards in the body. It is here placed under the alveoli with which it communicates by small openings. On arriving at the incisor teeth, it turns back to communicate with the mental foramen, giving off two small canals which run forward to be lost in the cancellous tissue of the bone beneath the incisor teeth. This canal in the posterior 2/3 of the bone runs nearest the internal surface of the jaw and in the anterior third nearer its external surface. Its walls are composed of compact tissue at either extremity, cancellous in the center. It contains the inferior dental vessels and nerve from which branches are distributed to the teeth through the small apertures at the bases of the alveoli. The superior border is thin and presents two processes separated by a deep concavity, the sigmoid notch. Of these processes, the anterior is the coronoid, the posterior the condyloid. The coronoid process is a thin, flattened, triangular eminence of bone which varies in length in different subjects. Its external surface is smooth and affords attachment to the masseter and temporal muscles. Its internal surface gives attachment to the temporal muscle and presents the commencement of a longitudinal ridge which is continued to the posterior part of the alveolar process. In front of this ridge is a deep groove continued below onto the outer side of the alveolar process. This ridge and part of the groove afford attachment above to the temporal, below to the buccinator muscle. The condyloid process, shorter but thicker than the coronoid, consists of two portions, the condyle and the constricted portion which supports the condyle, the neck. The condyle is of an oval form, its long axis being transverse and placed in such a manner that its outer end is a little more forward and a little higher than its inner. It is convex from before backwards and from side to side, the articular surface extending further on the posterior than on the anterior surface. The neck of the condyle is flattened from before backwards. Its posterior surface is convex, its anterior is hollowed out on its inner side by depression, the pterygoid fossa, for the attachment of the external pterygoid. The lower border of the ramus is thick, straight, and continuous with the body of the bone. At its junction with the posterior border is the angle of the jaw, which is somewhat averted, rough on each side for the attachment of the masseter externally, and the internal pterygoid internally, and between them serving for the attachment of the stylomaxillary ligament. The anterior border is thin above, thicker below, and continuous with the external oblique line. The posterior border is thick, smooth, and rounded and covered by the parotid gland. The sigmoid notch separating the two processes is a deep semilunar depression crossed by the mesenteric artery and nerve. Development. This bone is formed at such an early period of life before, indeed, any other bone excepting the clavicle, that it has been found impossible at present to determine its earliest condition. It appears probable, however, that it is developed by two centers, one for each lateral half, the two segments meeting at the symphysis where they become united. Additional centers have also been described for the coronoid process, the condyle, the angle, and the thin plate of bone which forms the inner side of the alveolus. At birth, it consists of two lateral halves. These join at the symphysis at the end of the first year, but a trace of separation at their upper part is seen at the commencement of the second year. Articulations with the glenoid fossae of the two temporal bones. Attachment of muscles by its external surface commencing at the symphysis and proceeding backwards. Levator menti, depressor labii inferioris, depressor anguli oris, platysma myoides, buccinator, masseter. By its internal surface commencing at the same point, geniohyoglossus, geniohyoideus, mylohyoideus, digastric, superior constrictor, temporal, internal pterygoid, external pterygoid. Articulations of the cranial bones. The bones of the cranium and face are connected to each other by means of sutures. The cranial sutures may be divided into three sets: those of the vertex of the skull, those at the side of the skull, those at the base. The sutures at the vertex of the skull are three: the sagittal, coronal, and lambdoid. The sagittal suture, from sagitta, Latin, an arrow, is formed by the junction of the two parietal bones and extends from the middle of the frontal bone backwards to the superior angle of the occipital. In childhood and occasionally in the adult, when the two halves of the frontal bone are not united, it is continued forwards to the root of the nose. This suture sometimes presents near its posterior extremity, the parietal foramen on each side, and in front where it joins the coronal suture, a space is occasionally left which encloses a large Wormian bone. The coronal suture extends transversely across the vertex of the skull and connects the frontal with the parietal bones. It commences at the extremity of the great wing of the sphenoid on one side and terminates at the same point on the opposite side. The dentations of this suture are more marked at the sides than at the summit and are so constructed that the frontal rests on the parietal above, whilst laterally the parietal supports the frontal. The lambdoid suture, so called from its resemblance to the Greek letter lambda, connects the occipital with the parietal bones. It commences on each side at the angle of the mastoid portion of the temporal bone and inclines upwards to the end of the sagittal suture. The dentations of this suture are very deep and distinct and are often interrupted by several small Wormian bones. The sutures at the side of the skull are also three in number: the sphenoparietal, squamoparietal, and mastoparietal. They are subdivisions of a single suture formed between the lower border of the parietal and the temporal and sphenoid bones and extending from the lower end of the lambdoid suture behind to the lower end of the coronal suture in front. The sphenoparietal is very short and formed by the tip of the great wing of the sphenoid and the anterior inferior angle of the parietal bone. The squamoparietal or squamous suture is arched. It is formed by the squamous portion of the temporal bone overlapping the middle division of the lower border of the parietal. The mastoparietal is a short suture deeply dentated, formed by the posterior inferior angle of the parietal and the superior border of the mastoid portion of the temporal. The sutures at the base of the skull are the basilar in the center, and on each side the petro-occipital, the masto-occipital, the petrosphenoidal, and the squamosphenoidal. The basilar suture is formed by the junction of the basilar surface of the occipital bone with the posterior surface of the body of the sphenoid. At an early period of life, a thin plate of cartilage exists between these bones, but in the adult they become inseparably united. Between the outer extremity of the basilar suture and the termination of the lambdoid, an irregular suture exists which is subdivided into two portions. The inner portion, formed by the union of the petrous part of the temporal with the occipital bone, is termed the petro-occipital. The outer portion, formed by the junction of the mastoid part of the temporal with the occipital, is called the masto-occipital. Between the bones forming the petro-occipital suture, a thin plate of cartilage exists. In the masto-occipital is occasionally found the opening of the mastoid foramen. Between the outer extremity of the basilar suture and the sphenoparietal, an irregular suture may be seen formed by the union of the sphenoid with the temporal bone. The inner and smaller portion of this suture is termed the petrosphenoidal. It is formed between the petrous portion of the temporal and the great wing of the sphenoid. The outer portion of greater length and arched is formed between the squamous portion of the temporal and the great wing of the sphenoid. It is called the squamosphenoidal. The cranial bones are connected with those of the face and the facial with each other by numerous sutures which, though distinctly marked, have received no special names. The only remaining suture deserving special consideration is the transverse. This extends across the upper part of the face and is formed by the junction of the frontal with the facial bones. It extends from the external angular process of one side to the same point on the opposite side and connects the frontal with the malar, the sphenoid, the ethmoid, the lacrimal, the superior maxillary, and the nasal bones on each side. The skull. The skull, formed by the union of the several cranial and facial bones already described, when considered as a whole, is divisible into 5 regions: a superior region or vertex, an inferior region or base, 2 lateral regions, and an anterior region, the face. The superior region or vertex presents 2 surfaces, an external and an internal. The external surface is bounded in front by the nasal eminences and superciliary ridges, behind by the occipital protuberance and superior curved lines of the occipital bone, laterally by an imaginary line extending from the outer end of the superior curved line along the temporal ridge to the external angular process of the frontal. This surface includes the vertical portion of the frontal, the greater part of the parietal, and the superior third of the occipital bone. It is smooth, convex, of an elongated oval form, crossed transversely by the coronal suture, and from before backwards by the sagittal, which terminates behind in the lambdoid. From before backwards may be seen the frontal eminences and remains of the suture connecting the two lateral halves of the frontal bone. On each side of the sagittal suture is the parietal foramen and parietal eminence, and still more posteriorly the smooth convex surface of the occipital bone. The internal surface of the vertex is concave, presents eminences and depressions for the convolutions of the brain, and numerous furrows for the lodgement of branches of the meningeal arteries. Along the middle line of this surface is a longitudinal groove, narrow in front, where it terminates in the frontal crest, broader behind. It lodges the superior longitudinal sinus, and its margins afford attachment to the falx cerebri. On either side of it are several depressions for the Pacchionian bodies, and at its base back part the internal openings of the parietal foramina. This surface is also crossed in front by the coronal suture, from before backwards by the sagittal, behind by the lambdoid. Base of the skull. The inferior region or base of the skull presents two surfaces, an internal or cerebral and an external or basilar. The internal or cerebral surface is shown in figure 50. The internal or cerebral surface is divisible into three parts or fossae called the anterior, middle, and posterior fossae of the cranium. The anterior fossa is formed by the orbital plate of the frontal, the cribriform plate of the ethmoid, the ethmoidal process, and lesser wing of the sphenoid. It is the most elevated of the three fossae, convex on each side where it corresponds to the root of the orbits, concave in the median line in the situation of the cribriform plate of the ethmoid. It is traversed by three sutures, the ethmoidofrontal, ethmosphenoidal, and frontosphenoidal, and lodges the anterior lobes of the cerebrum. It presents in the median line from before backwards the commencement of the groove for the superior longitudinal sinus and crest for the attachment of the falx cerebri. The foramen cecum, this aperture, is formed by the frontal and crista galli of the ethmoid, and if pervious, transmits a small vein from the nose to the superior longitudinal sinus. Behind the foramen cecum is the crista galli, the posterior margin of which affords attachment to the falx cerebri. On either side of the crista galli is the olfactory groove, which supports the bulb of the olfactory nerves, perforated by three sets of orifices which give passage to its filaments, and in front by a slit-like opening which transmits the nasal branch of the ophthalmic nerve. On each side are the internal openings of the anterior and posterior ethmoidal foramina, the former situated about the middle of its outer margin, transmitting the nasal nerve, which runs in a groove along its surface to the slit-like opening above mentioned, whilst the later, the posterior ethmoidal foramen, opens at the back part of this margin under cover of a projecting lamina of the sphenoid. It transmits the posterior ethmoidal artery and vein to the posterior ethmoidal cells. Further back in the middle line is the ethmoidal spine, bounded behind by an elevated ridge, separating a longitudinal groove on each side which support the olfactory nerves. The anterior fossa presents laterally eminences and depressions for the convolutions of the brain and grooves for the lodgement of the anterior meningeal arteries. The middle fossa, somewhat deeper than the preceding, is narrow in the middle and becomes wider as it expands laterally. It is bounded in front by the posterior margin of the lesser wing of the sphenoid, the anterior clinoid process, and the anterior margin of the optic groove. Behind by the petrous portion of the temporal and basilar suture, externally by the squamous portion of the temporal and anterior inferior angle of the parietal bone, and is divided into two lateral parts by the sella turcica. It is traversed by four sutures, the squamous, sphenoparietal, sphenotemporal, and petrosphenoidal. In the middle line, from before backwards, is the optic groove, which supports the optic commissure, terminating on each side in the optic foramen for the passage of the optic nerve and ophthalmic artery. Behind is seen the olivary process and laterally the anterior clinoid processes, which afford attachment to the defolds of the dura mater, which form the cavernous sinus. In the center of the middle fossa is the sella turcica, a deep depression which lodges the pituitary gland, bounded in front by a small eminence on either side, in the middle clinoid process, and behind by a broad square plate of bone surmounted at each superior angle by a tubercle, the posterior clinoid process. Beneath the latter process is a groove for the lodgement of the sixth nerve. On each side of the sella turcica is the cavernous groove. It is broad, shallow, and curved somewhat like the italic letter S. It commences behind at the foramen lacerum medium and terminates on the inner side of the anterior clinoid process. This groove lodges the cavernous sinus, the internal carotid artery, and the orbital nerves. The sides of the middle fossa are of considerable depth. They present eminences and depressions for the middle lobes of the brain and grooves for lodging the branches of the middle meningeal artery. These commence on the outer side of the foramen spinosum and consist of two larger branches, an anterior and a posterior. The former passing upwards and forwards to the anterior inferior angle of the parietal bone, the latter passing upwards and backwards. The following foramina may also be seen from before backwards. Most anteriorly is the foramen lacerum anterius or sphenoidal fissure, formed above by the lesser wing of the sphenoid, below by the greater wing, internally by the body of the sphenoid, and completed externally by the orbital plate of the frontal bone. It transmits the third, fourth, the three branches of the ophthalmic division of the fifth, the sixth nerve, and the ophthalmic vein. Behind the inner extremity of the sphenoidal fissure is the foramen rotundum for the passage of the second division of the fifth or superior maxillary nerve. Still more posteriorly is seen a small orifice, the foramen vesali. This opening is situated between the foramen rotundum and ovale, a little internal to both. It varies in size in different individuals and transmits a small vein. It opens below in the pterygoid fossa, just at the outer side of the scaphoid depression. Posteriorly and externally is the foramen ovale, which transmits the third division of the fifth or inferior maxillary nerve, the small meningeal artery, and the small petrosal nerve. On the outer side of the foramen ovale is the foramen spinosum for the passage of the middle meningeal artery, and on the inner side of the foramen ovale, the foramen lacerum medium. This aperture in the recent state is filled up with cartilage. On the anterior surface of the petrous portion of the temporal bone is seen from without inwards the eminence caused by the projection of the superior semicircular canal, the groove leading to the hiatus fallopi for the transmission of the petrosal branch of the Vidian nerve. Beneath it, the smaller groove for the passage of the smaller petrosal nerve, and near the apex of the bone, the depression for the semilunar ganglion and the orifice of the carotid canal for the passage of the internal carotid artery and carotid plexus of nerves. The posterior fossa, deeply concave, is the largest of the three and situated on a lower level than either of the preceding. It is formed by the occipital, the petrous and mastoid portions of the temporal, and the posterior inferior angle of the parietal bones. Is crossed by three sutures, the petro-occipital, masto-occipital, and masto-parietal, and lodges the cerebellum, pons varolii, and medulla oblongata. It is separated from the middle fossa and the median line by the basilar suture, and on each side by the superior border of the petrous portion of the temporal bone. This serves for the attachment of the tentorium cerebelli, is grooved externally for the superior petrosal sinus, and at its inner extremity presents a notch upon which rests the fifth nerve. Its circumference is bounded posteriorly by the groove for the lateral sinus. In the center of this fossa is the foramen magnum, bounded on either side by a rough tubercle, which gives attachment to the odontoid ligaments. And a little above these are seen the internal openings of the anterior condyloid foramina. In front of the foramen magnum is the basilar process, grooved for the support of the medulla oblongata and pons varolii, and articulating on each side with the petrous portion of the temporal bone, forming the petro-occipital suture, the anterior half of which is grooved for the inferior petrosal sinus, the posterior half being encroached upon by the foramen lacerum posterius or jugular foramen. This foramen is partially subdivided into two parts. The posterior and larger division transmits the internal jugular vein, the anterior the eighth pair of nerves. Above the jugular foramen is the internal auditory foramen for the auditory and facial nerves and auditory artery. Behind and external to this is the slit-like opening leading into the aqueductus vestibuli. Whilst between these two later and near the superior border of the petrous portion is a small triangular depression which lodges a process of the dura mater and occasionally transmits a small vein into the substance of the bone. Behind the foramen magnum are the inferior occipital fossae which lodge the lateral lobes of the cerebellum, separated from one another by the internal occipital crest, which serves for the attachment of the falx cerebelli and lodges the occipital sinuses. These fossae are surmounted above by the deep transverse grooves for the lodgement of the lateral sinuses, that on the right side being usually larger than the left. These channels, in their passage outwards, groove the occipital bone, the posterior inferior angle of the parietal, the mastoid portion of the temporal, and the occipital just behind the jugular foramen, at the back part of which they terminate. Where this sinus grooves the mastoid part of the temporal bone, the orifice of the mastoid foramen may be seen, and just previous to its termination, it has opening into it the posterior condyloid foramen. The external surface of the base of the skull, as shown in figure 51, is extremely irregular. It is bounded in front by the incisor teeth in the upper jaws, behind by the superior curved lines of the occipital bone, and laterally by the lower border of the malar bone, the zygomatic arch, and an imaginary line extending from the zygoma to the mastoid process and extremity of the superior curved line of the occiput. It is formed by the palate processes of the two superior maxillary and palate bones, the vomer, the pterygoid, undersurface of the great wing, spinous process, and part of the body of the sphenoid, the undersurface of the squamous, mastoid, and petrous portions of the temporal and occipital bones. The anterior part of the base of the skull is raised above the level of the rest of this surface when the skull is turned over for the purpose of examination, surrounded by the alveolar process, which is thicker behind than in front and excavated by 16 depressions for lodging the teeth of the upper jaw. They vary in depth and size according to the teeth they contain. Immediately behind the incisor teeth is the anterior palatine fossa or canal. At the bottom of this fossa may usually be seen four apertures, two placed laterally, which open above, one in the floor of each nostril and transmit the anterior palatine vessels, and two in the medial line of the intermaxillary suture, one in the front of the other, the most anterior one transmitting the left, and the posterior one, the larger, the right nasopalatine nerve. These two lateral canals are sometimes wanting, or they may join to form a single one, or one of them may open into one of the lateral canals above referred to. The palatine vault is concave, uneven, perforated by numerous nutritious foramina, marked by depressions for the palatal glands, and crossed by a crucial suture, which indicates the point of junction of the four bones of which it is composed. One or two small foramina seen in the alveolar margin behind the incisor teeth, occasionally seen in the adult, almost constant in young subjects, are called the incisive foramina. They transmit nerves and vessels to the incisor teeth. At each posterior angle is the posterior palatine foramen for the transmission of the posterior palatine vessels and anterior palatine nerve, and running forwards and inwards from it a groove which lodges the same vessels and nerve. Behind the posterior palatine foramen is the tuberosity of the palate bone, perforated by one or more accessory posterior palatine canals and marked by the commencement of a ridge which runs transversely inwards and serves for the attachment of the tendinous expansion of the tensor palati muscle. Projecting backwards from the center of the posterior border of the hard palate is the posterior nasal spine for the attachment of the azygos uvulae. Behind and above the hard palate is the posterior aperture of the nas, divided into two parts by the vomer, bounded above by the body of the sphenoid, below by the horizontal plate of the palate bone, and laterally by the pterygoid processes of the sphenoid. Each aperture measures about an inch in the vertical and half an inch in the transverse direction. At the base of the vomer may be seen the expanded alae of this bone, receiving between them the rostrum of the sphenoid. Near the lateral margins of the vomer at the root of the pterygoid process are the pterygopalatine canals. The pterygoid process, which bounds the posterior nares on each side, presents near its base the pterygoid or Vidian canal for the Vidian nerve and artery. Each process consists of two plates which bifurcate at the extremity to receive the tuberosity of the palate bone and are separated behind by the pterygoid fossa, which lodges the internal pterygoid muscle. The internal plate is long and narrow, presenting on the outer side of its base the scaphoid fossa for the origin of the tensor palati muscle, and at its extremity the hamular process around which the tendon of this muscle turns. The external pterygoid plate is broad, forms the internal boundary of the zygomatic fossa, and affords attachment to the external pterygoid muscle. Behind the nasal fossa in the middle line is the basilar surface of the occipital bone, presenting in its center the pharyngeal spine for the attachment of the superior constrictor muscle of the pharynx, with depressions on each side for the insertion of the rectus anticus major and minor. At the base of the external pterygoid plate is the foramen ovale. Behind this, the foramen spinosum and the prominent spinous process of the sphenoid, which gives attachment to the internal lateral ligament of the lower jaw and the maxillary tympani muscle. External to the spinous process is the glenoid fossa, divided into two parts by the Glaserian fissure, the anterior portion being concave, smooth, bounded in front by the eminentia articularis, and serving for the articulation of the condyle of the lower jaw. The posterior portion rough, bounded behind by the vaginal process and serving for the reception of part of the parotid gland. Emerging from between the laminae of the vaginal process is the styloid process, and at the base of this process is the stylomastoid foramen for the exit of the facial nerve and entrance of the stylomastoid artery. External to the stylomastoid foramen is the auricular fissure for the auricular branch of the pneumogastric, bounded behind by the mastoid process. Upon the inner side of this process is a deep groove, the digastric fossa, and a little more internally the occipital groove for the occipital artery. At the base of the internal pterygoid plate is a large and somewhat triangular aperture, the foramen lacerum medium, bounded in front by the great wing of the sphenoid, behind by the apex of the petrous portion of the temporal bone, and internally by the body of the sphenoid and basilar process of the occipital bone. It presents in front the posterior orifice of the Vidian canal, behind the aperture of the carotid canal. This opening is filled up in the recent subject by a fibrocartilaginous substance. Across its upper or cerebral aspect passes the internal carotid artery and Vidian nerve. External to this aperture, the petrosphenoidal suture is observed, at the outer termination of which is seen the orifice of the canal for the eustachian tube and that for the tensor tympani muscle. Behind this suture is seen the under surface of the petrous portion of the temporal bone, presenting from within outwards the quadrilateral rough surface, part of which affords attachment to the levator palati and tensor tympani muscles. Behind this surface are the orifices of the carotid canal and the aqueductus cochleae, the former transmitting the internal carotid artery and the ascending branches of the superior cervical ganglion of the sympathetic, the latter serving for the passage of a small artery and vein to the cochlea. Behind the carotid canal is a very large irregular aperture, the jugular fossa, formed in front by the petrous portion of the temporal and behind by the occipital. It is generally larger on the right than on the left side and is perforated at the bottom by an irregular aperture. It is divided into two parts by a ridge of bone which projects usually from the temporal. The anterior or smaller portion transmitting the three divisions of the eighth pair of nerves, the posterior transmitting the internal jugular vein and the two ascending meningeal vessels from the occipital and ascending pharyngeal arteries. On the ridge of bone dividing the carotid canal from the jugular fossa is the small foramen for the transmission of the tympanic nerve. And on the outer wall of the jugular foramen near the root of the styloid process is the small aperture for the transmission of Arnold's nerve. Behind the basilar surface of the occipital bone is the foramen magnum, bounded on each side by the condyles, rough internally for the attachment of the alar ligaments, and presenting externally a rough surface, the jugular process, which serves for the attachment of the rectus lateralis. On either side of each condyle, anteriorly is the anterior condyloid fossa, perforated by the anterior condyloid foramen for the passage of the lingual nerve. Behind each condyle are the posterior condyloid fossae, perforated on one or both sides by the posterior condyloid foramina for the transmission of a vein to the lateral sinus. Behind the foramen magnum is the external occipital crest, terminating above at the external occipital tuberosity, whilst on each side are seen the superior and inferior curved lines. These, as well as the surfaces of the bone between them, being rough for the attachment of numerous muscles. Lateral regions of the skull. The lateral regions of the skull are somewhat of a triangular form, their base being formed by a line extending from the external angular process of the frontal bone along the temporal ridge backwards to the outer extremity of the superior curved line of the occiput, and the sides being formed by two lines, the one drawn downwards and backwards from the external angular process of the frontal bone to the angle of the lower jaw, the other from the angle of the jaw upwards and backwards to the extremity of the superior curved line. This region is divisible into three portions: temporal, mastoid, and zygomatic. The temporal fossae. The temporal portion or fossa is bounded above and behind by the temporal ridge, which extends from the external angular process of the frontal upwards and backwards across the frontal and parietal bones, curving downwards behind to terminate at the root of the zygomatic process. In front, it is bounded by the frontal, malar, and great wing of the sphenoid. Externally, by the zygomatic arch formed conjointly by the malar and temporal bones. Below, it is separated from the zygomatic fossa by the pterygoid ridge seen on the undersurface of the great wing of the sphenoid. This fossa is formed by five bones: part of the frontal, great wing of the sphenoid, parietal, squamous portion of the temporal, and malar bones, and is traversed by five sutures: the transverse facial, coronal, sphenoparietal, squamoparietal, and squamosphenoidal. It is deeply concave in front, convex behind, traversed by numerous grooves for lodging the branches of the deep temporal arteries, and filled by the temporal muscle. The mastoid portion is bounded in front by the anterior horizontal root of the zygoma, above by a line which corresponds with the posterior root of the zygoma and the mastoparietal suture, behind and inferiorly by the masto-occipital suture. It is formed by the mastoid and part of the squamous portion of the temporal bone. Its surface is convex and rough for the attachment of muscles and presents from behind forwards the mastoid foramen below the mastoid process. In front of the mastoid process is the external auditory meatus surrounded by the auditory process. Anterior to the meatus is the glenoid fossa, bounded in front by the tubercle of the zygoma, behind by the auditory process, and above by the middle root of the zygoma, which terminates at the Glaserian fissure. The zygomatic fossae. The zygomatic fossae are two irregular shaped cavities situated one on each side of the head, below and on the inner side of the zygoma. Bounded in front by the tuberosity of the superior maxillary bone and the ridge which descends from its malar process, behind by the posterior border of the pterygoid process, above by the pterygoid ridge on the under surface of the great wing of the sphenoid and squamous portion of the temporal, below by the alveolar border of the superior maxilla, internally by the external pterygoid plate, and externally by the zygomatic arch and ramus of the jaw. It contains the lower part of the temporal, the external and internal pterygoid muscles, the internal maxillary artery, the inferior maxillary nerve, and their branches. At its upper and inner part may be observed two fissures, the sphenomaxillary and pterygomaxillary. The sphenomaxillary fissure, horizontal in direction, opens into the outer and back part of the orbit. It is formed above by the lower border of the orbital surface of the great wing of the sphenoid, below by the posterior rounded border of the superior maxilla, and a small part of the palate bone. Externally, by a small part of the malar bone. Internally, it joins at right angles with the pterygomaxillary fissure. This fissure opens a communication from the orbit into three fossae: the temporal, zygomatic, and sphenomaxillary. It transmits the superior maxillary nerve, infraorbital artery, and ascending branches from Meckel's ganglion. The pterygomaxillary fissure is vertical and descends at right angles from the inner extremity of the preceding. It is a triangular interval formed by the divergence of the superior maxillary bone from the pterygoid process of the sphenoid. It serves to connect the sphenomaxillary fossa with the zygomatic and transmits branches of the internal maxillary artery. The sphenomaxillary fossa. The sphenomaxillary fossa is a small triangular space situated at the angle of junction of the sphenomaxillary and pterygomaxillary fissures and placed beneath the apex of the orbit. It is formed above by a small part of the undersurface of the body of the sphenoid, in front by the superior maxillary bone, behind by the pterygoid process of the sphenoid. Internally by the vertical plate of the palate, externally it communicates with the sphenomaxillary fissure. This fossa has three fissures terminating in it: the sphenoidal, sphenomaxillary, and pterygomaxillary. It communicates with three fossae, the orbital, nasal, and zygomatic, and with the cavity of the cranium, and has opening into it 5 foramina. Of these, there are 3 on the posterior wall: the foramen rotundum above, the Vidian below and internal, and still more inferior and internal, the pterygopalatine. On the inner wall is the sphenopalatine foramen, by which it communicates with the nasal fossa, and below the superior orifice of the posterior palatine canal, besides occasionally the orifices of 2 or 3 accessory posterior palatine canals. Anterior region of the skull is shown in figure 52. The anterior region of the skull, which forms the face, is of an oval form, presents an irregular surface, and is excavated for the reception of the 2 principal organs of sense, the eye and the nose. It is bounded above by the nasal eminences and margins of the orbit, below by the prominence of the chin, on each side by the malar bone and anterior margin of the ramus of the jaw. In the medial line are seen from above downwards the nasal eminences, which indicate the situation of the frontal sinuses. Diverging outwards from them, the superciliary ridges which support the eyebrows. Beneath the nasal eminences is the arch of the nose, formed by the nasal bones and the nasal process of the superior maxillary. The nasal arch is convex from side to side, concave from above downwards, presenting in the median line the internasal suture formed between the nasal bones, laterally the nasomaxillary suture formed between the nasal and the nasal process of the superior maxillary bones, both these sutures terminating above in that part of the transverse suture which connects the nasal bones and nasal processes of the superior maxillary with the frontal. Below the nose is seen the heart-shaped opening of the anterior nares, the narrow end upwards and broad below. It presents laterally the thin sharp margins which serve for the attachment of the lateral cartilages of the nose, and in the middle line below a prominent process, the anterior nasal spine bounded by 2 deep notches. Below this is the intermaxillary suture, and on each side of it the incisive fossa. Beneath this fossa is the alveolar process of the upper and lower jaw, containing the incisive teeth, and at the lower part of the median line, the symphysis of the chin, the mental eminence, and the incisive fossa of the lower jaw. Proceeding from above downwards, on each side are the supraorbital ridges, terminating externally in the external angular process at its junction with the malar, and internally in the internal angular process. Towards the inner third of this ridge is the supraorbital notch or foramen for the passage of the supraorbital vessels and nerve, and at its inner side a slight depression for the attachment of the cartilaginous pulley of the superior oblique muscle. Beneath the supraorbital ridges are the openings of the orbits, bounded externally by the orbital ridge of the malar bone, Below, by the orbital ridge formed by the malar, superior maxillary, and lacrimal bones. Internally, by the nasal process of the superior maxillary and the internal angular process of the frontal bone. On the outer side of the orbit is the quadrilateral anterior surface of the malar bone, perforated by one or two small malar foramina. Below the inferior margin of the orbit is the infraorbital foramen, the termination of the infraorbital canal, and beneath this, the canine fossa, which gives attachment to the levator anguli oris, bounded below by the alveolar processes containing the teeth of the upper and lower jaw. Beneath the alveolar arch of the lower jaw is the mental foramen for the passage of the mental nerve and artery, the external oblique line, and at the lower border of the bone, at the point of junction of the body with the ramus, a shallow groove for the passage of the facial artery. The orbits. The orbits are shown in figure 52. The orbits are two quadrilateral hollow cones situated at the upper and anterior part of the face, their bases being directed forwards and outwards, and their apices backwards and inwards. Each orbit is formed of 7 bones: the frontal, sphenoid, ethmoid, superior maxillary, malar, lacrimal, and palate. But 3 of these, the frontal, ethmoid, and sphenoid, enter into the formation of both orbits, so that the 2 cavities are formed of 11 bones only. Each cavity presents for examination a roof, a floor, an inner and an outer wall, a circumference or base, and an apex. The roof is concave, directed downwards and forwards, and formed in front by the orbital plate of the frontal, behind by the lesser wing of the sphenoid. This surface presents internally the depression for the fibrocartilaginous pulley of the superior oblique muscle, externally the depression for the lacrimal gland, and posteriorly the suture connecting the frontal and lesser wing of the sphenoid. The floor is nearly flat and of less extent than the roof. It is formed chiefly by the orbital process of the superior maxillary, in front to a small extent by the orbital process of the malar, and behind by the orbital surface of the palate. This surface presents at its anterior and internal part, just external to the lacrimal canal, a depression for the attachment of the tendon of origin of the inferior oblique muscle. Externally, the suture between the malar and superior maxillary bones. Near its middle, the infraorbital groove, and posteriorly the suture between the maxillary and palate bones. The inner wall is flattened and formed from before backwards by the nasal process of the superior maxillary, the lacrimal, os planum of the ethmoid, and a small part of the body of the sphenoid. This surface presents the lacrimal groove and crest of the lacrimal bone, and the sutures connecting the ethmoid in front with the lacrimal, behind with the sphenoid. The outer wall is formed in front by the orbital process of the malar bone, behind by the orbital plate of the sphenoid. On it are seen the orifices of 1 or 2 malar canals and the suture connecting the sphenoid and malar bones. Angles. The superior external angle is formed by the junction of the upper and outer walls. It presents from before backwards the sutures connecting the frontal with the malar in front and with the orbital plate of the sphenoid behind. Quite posteriorly is the foramen lacerum anterius or sphenoidal fissure, which transmits the 3rd, 4th ophthalmic division of the 5th and 6th nerves and the ophthalmic vein. The superior internal angle is formed by the junction of the upper and inner wall and presents the suture connecting the frontal with the lacrimal in front and with the ethmoid behind. This suture is perforated by 2 foramina, the anterior and posterior ethmoidal, the former transmitting the anterior ethmoidal artery and nasal nerve, the latter the posterior ethmoidal artery and vein. The inferior external angle formed by the junction of the outer wall and floor presents the sphenomaxillary fissure, which transmits the infraorbital vessels and nerve and the ascending branches from the sphenopalatine ganglion. The inferior internal angle is formed by the union of the lacrimal and os planum of the ethmoid, which the superior maxillary and palate bones. The circumference or base of the orbit, quadrilateral in form, is bounded above the supraorbital arch, below by the anterior border of the orbital plate of the malar, superior maxillary and lacrimal bones. Externally by the external angular process of the frontal and malar bone, internally by the internal angular process of the frontal and nasal process of the superior maxillary. The circumference is marked by three sutures: the frontomaxillary internally, the frontomalar externally, and the malomaxillary below. It contributes to the formation of the lacrimal groove and presents above the supraorbital notch or foramen for the passage of the supraorbital artery, veins, and nerve. The apex, situated at the back of the orbit, corresponds to the optic foramen, a short circular canal which transmits the optic nerve and ophthalmic artery. It will thus be seen that there are 9 openings communicating with each orbit, with the optic foramen lacerum, anterius sphenomaxillary fissure, supraorbital foramen, infraorbital canal, anterior and posterior ethmoidal foramina, malar foramina, and lacrimal canal. The nasal fossae. The nasal fossae are two large irregular cavities situated in the middle line of the face, separated from each other by a thin vertical septum and extending from the base of the cranium to the roof of the mouth. They communicate by two large apertures, the anterior nares with the front of the face and with the pharynx behind by the two posterior nares. These fossae are much narrower above than below and in the middle than at the anterior or posterior openings. Their depth, which is considerable, is much greater in the middle than at either extremity. Each nasal fossa communicates with 4 sinuses: the frontal in front, the sphenoidal behind, and the maxillary and ethmoidal on either side. Each fossa also communicates with 4 cavities: with the orbit by the lacrimal canal, with the mouth by the anterior palatine canal, with the cranium by the olfactory foramina, and with the sphenomaxillary fossa by the sphenopalatine foramen. And they occasionally communicate with each other by an aperture in the septum. The bones entering into their formation are 14 in number: 3 of the cranium, the frontal, sphenoid, and ethmoid, and all the bones of the face excepting the malar and lower jaw. Each cavity has 4 walls: a roof, a floor, an inner, and an outer wall. The upper wall or roof is shown in figure 53. The upper wall or roof is long, narrow, and concave from before backwards. It is formed in front by the nasal bones and nasal spine of the frontal, which are directed downwards and forwards. In the middle by the cribriform lamella of the ethmoid, which is horizontal, and behind by the under surface of the body of the sphenoid and sphenoidal turbinated bones, which are directed downwards and backwards. This surface presents from before backwards the internal aspect of the nasal bones. On their outer side, the suture formed between the nasal with the nasal process of the superior maxillary. On their inner side, the elevated crest which receives the nasal spine of the frontal and the perpendicular plate of the ethmoid and articulates with its fellow of the opposite side, whilst the surface of the bones is perforated by a few small vascular apertures and presents the longitudinal groove for the nasal nerve. Further back is the transverse suture connecting the frontal with the nasal in front and the ethmoid behind, the olfactory foramina on the undersurface of the cribriform plate and the suture between it and the sphenoid behind. Quite posteriorly are seen the sphenoidal turbinated bones, the orifice of the sphenoidal sinuses, and the articulation of the alley of the omer with the undersurface of the body of the sphenoid. The floor is flattened from before backwards, concave from side to side, and wider in the middle than at either extremity. It is formed in front by the palate process of the superior maxillary, behind by the palate process of the palate bone. This surface presents from before backwards the anterior nasal spine. Behind this, the upper orifice of the anterior palatine canal. Internally, the elevated crest which articulates with the vomer, and behind the suture between the palate and superior maxillary bones and the posterior nasal spine. The inner wall or septum is shown in figure 54. The inner wall or septum is a thin vertical septum which separates the nasal fossae from one another. It is occasionally perforated so that they communicate and is frequently deflected considerably to one side. It is formed in front by the crest of the nasal bones and nasal spine of the frontal, in the middle by the perpendicular lamella of the ethmoid, behind by the vomer and rostrum of the sphenoid, below by the crest of the superior maxillary and palate bones. It presents in front a large triangular notch which receives the triangular cartilage of the nose above the lower orifices of the olfactory canals and behind the guttural edge of the vomer. Its surface is marked by numerous vascular and nervous canals and traversed by sutures connecting the bones of which it is formed. The outer wall is formed in front by the nasal process of the superior maxillary and lacrimal bones, in the middle by the ethmoid and inner surface of the superior maxillary and inferior turbinated bones, behind by the vertical plate of the palate bone. This surface presents three irregular longitudinal passages or meatases formed between three horizontal plates of bone that spring from it. They are termed the superior, middle, and inferior meatases of the nose. The superior meatus, the smallest of the three, is situated at the upper and back part of each nasal fossa, occupying the posterior third of the outer wall. It is situated between the superior and middle turbinated bones and has opening into it two foramina, the sphenopalatine at the back part of its outer wall, the posterior ethmoidal cells at the front part of the upper wall. The opening of the sphenoidal sinuses is usually at the upper and back part of the nasal fossae, immediately behind the superior turbinated bone. The middle meatus, situated between the middle and inferior turbinated bones, occupies the posterior two-thirds of the outer wall of each nasal fossa. It presents two apertures. In front is the orifice of the infundibulum, by which the middle meatus communicates with the anterior ethmoidal cells, and through these with the frontal sinuses. At the center of the outer wall is the orifice of the antrum, which varies somewhat as to its exact position in different skulls. The inferior meatus, the largest of the three, is the space between the inferior turbinated bone and the floor of the nasal fossa. It extends along the entire length of the outer wall of the nose, is broader in front than behind, and presents anteriorly the lower orifice of the lacrimal canal. Os hyoides. The hyoid bone is named from its resemblance to the Greek upsilon. It is also called the lingual bone from supporting the tongue and giving attachment to its numerous muscles. It is a bony arch shaped like a horseshoe and consisting of 5 segments, a central portion or body, 2 greater cornua, and 2 lesser cornua. The body forms the central part of the bone, is of a quadrilateral form. Its anterior surface, which is shown in figure 55, is convex, directed forwards and upwards, and divided into two parts by a vertical ridge, which descends along the median line and is crossed at right angles by a horizontal ridge, so that this surface is divided into 4 muscular depressions. At the point of meeting of these two lines is a prominent elevation, the tubercle. The portion above the horizontal ridge is directed upwards and is sometimes described as the superior border. The anterior surface gives attachment to the geniohyoid bone to the geniohyoid muscle in the greater part of its extent, above to the geniohyoglossus muscle, below to the myohyoid, stylohyoid, and aponeurosis of the digastric, and between these to part of the hyoglossus. The posterior surface is smooth, concave, directed backwards and downwards, and separated from the epiglottis by the thyrohyoid membrane and by a quantity of loose areolar tissue. The superior border is rounded and gives attachment to the thyrohyoid membrane and part of the geniohyoglossy muscles. The inferior border gives attachment in front to the sternohyoid, behind to part of the thyrohyoid, and to the omohyoid at its junction with the great cornu. The lateral surfaces are small, oval, convex facets covered with cartilage for articulation with the greater cornua. The greater cornua project backwards from the lateral surfaces of the body. They are flattened from above downwards, diminish in size from before backwards, and terminate posteriorly in a tubercle for the attachment of the thyrohyoid ligament. Their outer surface gives attachment to the hyoglossus, their upper border to the middle constrictor of the pharynx, their lower border to part of the thyrohyoid muscle. The lesser cornua are two small conical shaped eminences attached by their bases to the angles of junction between the body and greater cornua and giving attachment by their apices to the stylohyoid ligaments. In youth, the cornua are connected to the body by cartilaginous surfaces and held together by ligaments. In middle life, the body and greater cornua usually become joined, and in old age, all the segments are united together, forming a single bone. Development by 5 centers, one for the body and one for each cornu. Ossification commences in the body and greater cornua towards the end of fetal life, those for the cornua first appearing. Ossification of the lesser cornua commences some months after birth. Attachment of muscles: sternohyoid, thyrohyoid, omohyoid, aponeurosis of the digastricus, stylohyoid, mylohyoid, geniohyoid, geniohyoglossus, hyoglossus, middle constrictor of the pharynx, and occasionally a few fibers of the lingualis. It also gives attachment to the thyrohyoidian membrane and the stylohyoid, thyrohyoid, and hyoepiglottic ligaments. The thorax. Okay, we'll see thorax in the second part of the osteology section of Gray's Anatomy. We'll read thorax in the second video. For now, I'm closing this video with a couple of my comments on what I'm missing from Gray. Actually, I guess I would have liked Gray to talk something about the inner aspect of the skull, that is the brain portion. The part of the skull which touches the brain, the inner portion of the cranium. That is the part of the human body most important for anthropology, especially to my particular field of interest within physical anthropology. So for that, I would have liked if, and also for another now debunked field of brain neuroscience called phrenology, which has been thoroughly discredited by now. But it was a curious phenomenon of the Victorian age. And for that also, it also deals with a lot of inner structure of the cranium, the different fossae, how the brain molds the cranium and skull and etc. So for that, it would have been better if Henry Gray had dealt with the inner aspect of the cranium also. The brain, the part of the cranium that touches the brain. Maybe he did, in bits and pieces throughout this description of the cranial bones, and which I might not have uh, gotten together in a coherent mode because I've been disturbed once in a while by phone calls, by my mother, and different factors. So probably I missed that portion due to slight lagging of attention, probably. Okay, guys, see you in the next video. Bye.